Okay, I'd like to call to order this meeting of the First 5 Sacramento Commission for Tuesday, February 18th to order. That's your cue to calm down. Very good. Madam Clerk, will you please call the roll and establish a quorum?
Chair Cerna.
Here.
Christina Elliott.
Here.
Eric Fernandez y Garcia.
Here.
David Gordon.
Here.
Olivia Casirier. Bruce Wagstaff.
Here.
Steve Wirtz.
Here.
Patrick Kennedy. Beth Hassett.
Here.
Lee Turner Johnson.
Here.
Donna Sneeringer.
Here.
Kathy Kosick. Terry Porter.
Here.
Scott Moak.
Here.
With Dr. Casirier being out today, we have a quorum.
I'm sorry?
She said we have a quorum.
We have a quorum, all right.
We have a quorum.
Great, thank you. Commissioner Gordon, will you do us the honor of leading us in the pledge, please?
Yes, sir. Luke, pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
This meeting.
Go ahead.
This meeting of the First 5 Sacramento Commission is cablecast live on Metro 14, the local government affairs channel on the Comcast, Consolidated Communications, and AT&T Uverse cable systems. This meeting is closed captioned and webcast at www.sacramentrocable.tv. Today's meeting will be repeated Friday, February 21st at 2 p.m. and Saturday, February 22nd at 2 p.m. on Channel 14. Members of the audience wishing to address the commission may fill out a speaker slip list located at the back of the room. Please speak into the microphone when addressing the commission and state your name for the record. If you have any electronic devices, please put them on silent or turn off now.
Great, thank you. A few announcements before we get to the substance of our agenda this afternoon. First, I'd like to welcome our new clerk of the commission, Stephanie Wills, and that's your cue to applaud. It's not always easy being the clerk of anything around here, and I want to make sure that Stephanie understands she's welcome here, and thank you already for keeping me in check as we begin the meeting today. So welcome. I also want to welcome some new folks to our commission, as well as moving from alternates to principal members of the commission. First, to my right, your left, Eric Fernandez y Garcia. Welcome to the commission.
Thank you.
And then those commissioners who have moved from alternates to principal members of the commission include Christina Elliott and Steve Wirtz. So congratulations to you. All right, and as people continue to enter chambers, I just want to remind folks that certainly everyone is welcome to address the commission on any item that's on our agenda or not on our agenda. We ask that you please complete a speaker form. We have staff in the back of chambers this afternoon as we have a full agenda to help you complete those speaker slips. And if you can get those to our clerk, that'll help expedite things. We do ask that you please respect the time limit. I think today, given the number of likely speakers, I'm going to keep the limit to 2 minutes per person. Again, any item on the agenda or off the agenda, you're welcome to address the commission. And with that, unless there's no other announcements, we're going to get to our busy agenda today. First item.
Approval of December 2nd, 2019 draft action summary.
Okay, any principal member of the commission wish to pull anything for change, revision? If not,
Move approval, Mr. Chairman.
it's been moved by Commissioner Wagstaff. Who seconded?
Second.
Seconded by Commissioner Wirtz. All in favor? Aye.
Aye.
Opposed, abstained, motion carries. Thanks. Okay, next item, please.
Appoint Commissioner Turner Johnson to the Financial Planning Committee.
Okay, this does require a vote, correct?
Yes.
Okay. All right. Any discussion? If not, the chair will move the appointment of Commissioner Turner Johnson to the Financial Planning Committee, and I'll look for a second. Seconded by Commissioner Elliott. All in favor? Aye. Opposed, abstained, motion carries. Congratulations. All right, now we're on to separate matters.
Public comments on off-agenda items.
Okay, I don't think I'm in receipt of any speaker slips thus far. I'm seeing shaking heads in the back that no one has signed up to speak off agenda. So we will then move on to item 5, please.
Executive Director's Report.
All right, very good.
Good afternoon, Commissioners.
Good afternoon.
Hope you're all doing well. I have a somewhat lengthy update, but I'm only going to highlight 2 things because we have a full meeting today. The first thing I just wanted to draw your attention to is one of our very own commissioners has been recognized at the state level. So Commissioner Donna Sneeringer was appointed to the governor's newly created Early Childhood Policy Council. We're super proud to have a local rep up there with her first 5 hat on and just sharing from the ground up what's needed in Sacramento and statewide too. But so congratulations and thanks for repping us. And the other thing that I wanted to do was just a couple staffing updates. So you do see Stephanie Wills. She's replaced Gail Saiputa, who retired in January after 30 years of county service. So we're very happy for her. And Stephanie promoted into the position. And then I have another retirement to announce today is Michelle Peterson. And I was going to ask if Michelle would join me at the podium. Thank you for just a couple of words. So Michelle has been... Michelle has been with First 5 Sacramento for 8 years. She's our Administrative Services Officer, overseeing our Birth and Beyond and Early Care and Learning programs. She's been with the county for nearly 33 years here, and she's incredibly smart, and she is so generous with her knowledge. She is a friend to everybody on our team, and I think a friend with just about everybody she's ever helped monitor their contract to. So we have just a small recognition for her, and we've celebrated her a couple times already, but just wanted to do this in front of the commission just to let you all know how much we appreciate her and how much we're going to miss you so much.
Very much for all those kind words. I appreciate it very much.
Best of luck to you.
Thank you for your service, Michelle.
Thank you.
That concludes my report.
Thank you. Any questions for our Executive Director before we move on? All right, seeing none. Next item, please.
Advisory Committee update.
Okay, is Mr. Silva here?
I don't see him, so I can give a quick update.
Okay.
We met on February 7th, and we basically gave 2 walkthrough presentations. One of them was our efforts to reduce African American child deaths. So we did a practice run at the advisory committee and made some small adjustments and got some good advice. We also did a practice run of our census presentation, which we're going to provide to the commission in March. So both presentations went through fine, and you'll be seeing them both shortly.
Very good. Thank you.
Appoint Ricky Townsend to Advisory Committee.
Yes, we do have to take some actions here. We have another appointment, don't we?
Yes. Walter
I was going to let you struggle with the last name.
Weinerizowski. I'm so sorry.
Walter Winertschik.
Thank you.
Okay, it's as close as we're going to get, I think.
Okay, we do need to take a vote, so I will make the motion that we appoint these 2 individuals. Is there a second? Second. Seconded by Commissioner Elliott. All in favor? Aye.
Aye.
Opposed? Abstained? Motion carries. Thank you. All right. Valuation report update.
Thank you, Commissioner. We met twice on January 13th and then again on January 31st, and spent the time hearing from our evaluators on their reports, and then spent the time looking at both the state report and the evaluation report we're going to hear about, as well as overview on the reduction of African American and perinatal and infant deaths reports. And we had quite a series of discussions, and the second meeting was to give our committee chance to review and update pieces that we felt we wanted to hear more about. But as always, the evaluation consultant and staff have been extremely responsive and valuable in presenting what I think is going to be a very important reports that you will be seeing shortly. So that was the bulk of our meeting, and I look forward to hearing more from our staff.
Great. Thank you. All right, Commissioner Kosick is not here.
I can give an update on the
Okay.
Financial Planning Committee. We met on January 16th, and we were not able to establish a quorum, so I'll keep it brief. One of the main issues I did talk about in this meeting was the slowdown in Proposition 10 disbursements. There was a 4-month delay, which caused some cash flow issues for many of the smaller counties. However, I'm happy to report that just recently the state did make those 4 payments, so everybody, we're going to keep an eye out on future payments so we can mitigate any delays as they come up if we are able to. And then finally, I did present the Q2 financial statements. In the absence of a quorum, we were unable to vote on them. And that concludes my report.
Great. Any questions for staff? Okay. Then we'll move on to sustainability.
The Sustainability Committee did not meet since our last meeting. Our next meeting is on March 17th, and we'll be talking about the governor's budget proposal and legislation, which I'm sure we'll be bringing some information back to you after that, and also preparing for First Five's Advocacy Day later in April.
Okay, great. Thank you. All right. Next item, please.
Approval of the 2021 strategic plan elements.
Okay, Julie, while you're making your way to the podium, let me just make a few introductory comments, because I know there are a number of people that are very interested in this item. I'm in receipt of 18 speaker slips, and I suspect I might get a few more before the staff is done with their report. But this is one of the most important activities that this commission does. This is, it's a little unusual compared to some of the other agencies, including the Board of Supervisors, in terms of how we budget. We kind of do a simultaneous budget exercise and strategic plan development here at the Commission that runs in 3-year increments. And there's a lot of thoughtfulness that goes into it. We have the uniqueness, the challenge, quite frankly, of having a declining budget here at First Five, like all First Fives across the state. It's declining by design because of the cessation of smoking. So that puts us oftentimes in a very challenged position to make sure that we are really understanding what we're committing ourselves to in terms of what is effective in terms of our mission. And it's the budget and the spending plan and the strategic elements should be no reflection that we devalue some services more than others. If we had our druthers, I'm sure my fellow commissioners and our staff would tell you we'd love to fund it all. We'd like to make our mission as broad as possible, given our charge under Proposition 10, but that's not the case. So that's why there's a lot of people here that are rightfully very interested in what we're doing today, and I appreciate everyone who came out today, took time out of your busy schedules, doing the great work that you're doing in the community to address this commission. So with that, Julie.
Thank you, sir. We have a PowerPoint presentation that should come up shortly. And what you will see on our presentation is staff's recommended approval of our 2021 strategic plan elements. So we have 6 elements that are before you today, and that they include our vision, our mission, our strategic principles, our spending plan, strategic plan hierarchy, and our result area allocations for 3 years, 2021 through 2024. We, as Chair Cerna mentioned, we start this presentation or this strategic plan with a 25% reduction from our current strategic plan, which is significant. And it is the second of our planned fiscal cliffs. We will have one additional fiscal cliff coming up in 2021. So I am happy to state, though, when we were looking at this about 18 months ago, we were planning for a 30% cut in this current this 2021 strategic plan. But because of the efforts that we have all been working on with sustainability and being able to draw down additional funds from other sources, that cut has been reduced to 25%. So that's a really great thing that Commission should be proud of. So, okay, it's actually supposed to be individual slides, so I'm not sure what's happening, but you got the first 2 slides. The second one is our roadmap, and that attests to the work done by the work group members and staff over the past 6 months. So the Commission appointed our strategic plan work group in May, and the work group and staff, with considerable input from the community, met 6 times or 5 times over 5 months to provide guidance to the staff. The work group members that I would like to thank so much as Commissioners Hassett, Moak, and Wirtz. And we had 2 advisory committee members, Alexandria Page and Katie Andrew, who also helped us with this work. Those meetings were lengthy, and we really had important conversations, and the work group did an amazing job of sussing through so much data and so much public input to get to these recommendations that you will see. So, the work group made minor revisions to some elements of our mission, our vision, and our strategic priorities. Those changes are detailed in your packet as attachment number 1. We didn't make changes to the vision statement. We thought that was fine. It remains that Sacramento County will have strong communities where children are safe and healthy and reach their full potential. We made a slight revision to our mission statement, and it now reads, in partnership with the community, we support a prevention and early intervention system that promotes optimal health and development, narrows disparities, and improves the lives of children 0 to 5 and their families. And then we did make a couple revisions to our strategic principles. These are the principles that the work group uses when they're making funding decisions, so they're really key to, I'd like to think of them as their strategic funding principles, really. And we narrowed it down to 5. Number 1, make narrow and deep investments to create lasting systemic change. Number 2, look for opportunities to leverage other dollars to sustain critical services for children and families. Number 3, choose strategies that promote prevention, early intervention, and community collaboration. Number 4, make data-informed decisions that address community needs, build community assets, and prioritize children and families at risk. And finally, number 5, focus services on children and families who face significant challenges to achieving their maximum physical, social, emotional, and learning potential. And that takes us to the spending plan. So I don't know if you want to approve them as we go or wait for the whole package.
I think what I'd like to do is certainly hear everything you have to say about all the elements that we're being asked to consider or component parts to this action, but I'd like to take one action if we can at the end.
Okay.
And again, after we hear from the public too.
Okay.
And Julie, is there nothing to be done about because people not being able to see it feels...
I think we have someone actually in the back room that's trying to figure that out right now.
I think Carmen went back there to try to do that. Yep. Very sorry about that because it's very hard to see what that spending plan looks like.
But if I can just mention, if you can you forward the slides yourself or not?
Actually, do you have a hard copy? You can put it on that white board right there and we can use the overhead.
Sure.
Because attachment 2 is
Yes,
the
is
bigger
the
picture of
spending
that.
plan.
Just
They can get way in on it.
It's sensitive.
Perfect. Yay. Okay. One way or another. So, within our spending plan, you'll see a breakout of administration, evaluation, and then both internal and external program costs. The administration line item represents a 20% decrease between 2021 strategic plan. That's reflective of cuts from internal commission staffing and expenses, and it's consistent with our current strategic plan in that admin will remain at 7% of the annual operating budget. We have an admin policy that limits an admin cap to 10% of the annual operating budget, and so we are well below that cap. The evaluation line item was also decreased by 20%, and this is a combination of reductions to internal commission staffing and expenses, as well as a slight decrease to contracted evaluation services in the next 3-year plan. And that remains consistent with the current plan. It's a 3% of the overall annual operating budget. So between admin and evaluation at 7% and 3%, that takes us 10%. 90% of funding in this spending plan is for services and programming. And with that, the total reduction of program costs was 26%. That's a combined cut of internal staffing and supplies and services, as well as contracts for services out the door. And in summary, it brings us from our current plan, which was almost $20 million, down to almost $15 million, so $5 million cut per year, and a total spending plan over 3 years of $44.6 million.
I think we have a question on the spending plan from Commissioner
Sure.
Wagstaff.
Thank you, Julie. Just as we go through, there's a couple of questions that we might. First of all, the cut that we have, is it safe to assume that all the first 5 commissions are going through basically the same process at the same level of cut?
Correct. Many have already reached their final fiscal cliff. We were fortunate to have a fairly large reserve from about 10 years ago, so we've taken ours a little bit slower. But I would say about half the counties have already reached their final cliff, and then the rest of us are all sort of taking cuts with each new strategic plan process.
But the degree of cut is comparable between the different, so it's not like we're having to take, and that's based on an allocation formula from the state.
From the state,
Right,
and
right.
it's really based on how much reserves commissions had in the bank going into. We've always known that we would have about a 2 to 5% per year reduction just in the decline of cigarette smoking. But these fiscal cliffs are much more related to how much of our reserves we have been strategically spending down throughout the years.
And the amount for admin that we're proposing, is there a way that you can describe how what we allocate for admin, given the size of our county, et cetera, compares to comparable counties?
We're actually quite low, not only for counties of our size, but just our overall staffing, not even just admin or evaluation, but including program staffing. We did a quick and dirty study of it. Thought this question might come up. And compared to our like-size counties, we have actually far fewer staff and FTE. So we're a lean, mean fighting machine, and we've been able to do it. We You'll see that I mentioned internal staff cuts across all three of these major line item areas. Back in the heyday, in 2009, the commission had, I believe, 24 FTE. When I started in 2015, we were down to 14 FTE, and moving into the 2021 strategic plan, we will be at 10.4 FTE, which I really cannot recommend going any lower than that, just to meet our statutory requirements and other obligations.
That's very useful. Thank you. Thank you,
Yeah.
Mr. Chairman.
So that is the strategic plan. And then the next slide, you may be able to see, well, you probably won't.
PowerPoint is fixed.
Oh, it is. Okay, great. So can I get the strategic plan hierarchy up? Perfect. So this is a quick, you won't be able to read all that, and that's okay. That's just a quick, I wanted you to have a snapshot of what our current strategic plan hierarchy looks like, because you're going to see in a minute what it compares to moving forward in 2021. So we currently had 3 priorities, 5 goals, and 10 result areas. And the work group had a super difficult job of narrowing down this hierarchy to something that's achievable with $5 million less to spend per year. And so what you will see next is that during the course of our meetings, the work group, they reviewed a lot of data, including a trend report, results of a parent survey and a provider survey on needs. Staff also gave presentations to the work group on just the general landscape of each of our result areas. And then the work group scored each of the result areas based on a criteria created by staff and our consultant and approved by the work group members. So the criteria included what that community indicator data told us from the trend data, what the priority and what the need was in the community for that result area. We looked at the parent and provider priorities and included those in our scoring. And we looked at gaps in resources. So how much, was anyone else funding this area? Were we the sole funder? We looked at our capacity to make an impact. So how much impact, if we dropped all of our money into it or a chunk of our money, what did we expect to get out of it? And then were there systems and policy opportunities available within each of the result areas? The scoring resulted in a ranked list of result areas from 1 to 10, and you'll see that shortly, 1 being the highest ranked result area. It was the highest priority, and 10 being the lowest. And with that, ta-da. This is the new, and it's still pretty hard to read in the audience, I apologize. This is the new strategic planning hierarchy. So it reduced down to from 5 goals down to 3 goals, and from 10 result areas down to 7 result areas. There is a crosswalk in your packet that will take you from what that result area name was, the goal, the priority, and all the changes made to each one. But I just wanted to walk you through a couple of the higher level, the bigger things that we did to create this new one. So under the health priority, we changed the goal to read, all children are born healthy and access preventive services to maintain optimal health. There used to be a result area specific to dental health, and we removed that and we dropped it and included it into result area 3, which was modified and now reads, where does it read? All children have access to quality, sorry, the wrong one. Okay, sorry. Anyway, sorry, I don't have it in front of me. But what it reads is that we're going to increase utilization of medical, dental, and mental health services for children and families. So we just sort of made it a bit more global and really talking about policies rather than direct services now for oral health.
You just recited that verbatim, so
Yeah.
congratulations.
Thank you. It's in there somewhere. And I was really just wanted to call the attention, even though it wasn't something that we were funding under the current strategic plan, maternal mental health and early child mental health really came to the front in our work group between the data that we saw and the parent survey that brought it out as a priority. There was even some write-ins where we didn't ask the question about maternal mental health, but it came up anyway. So this was our attempt to get it on our list. It's on our radar now, and it's one of our priorities. Under early care and learning, we changed that goal slightly to read all children have access to quality early learning experiences and are ready for kindergarten. And those 3 result areas under there remained primarily the same in that we're really trying to impact children's access to affordable childcare, to high quality early care and learning, as well as readiness for kindergarten. And then finally, under the Empowered Families priority, that goal was changed to read, all families have access to resources and opportunities that support their children's development and safety. What you'll notice is that Community Connections mini grants and our work around connecting families to resources has been eliminated from this, and that's a big loss for us, and we understand that. One of the driving forces behind that, first, it did score pretty low overall as a priority through all of that analysis that we did at the work group. And secondly, it's just a very high cost to administer that program. It takes a full-time FTE within the commission. So this was a way in which we could compromise and save some money. What remains is our Empowered Families. Under Empowered Families is a slightly changed goal that I just read, and 2 other result areas that were previously in there have been combined. And we've got the word trauma in there finally, which I've been wanting to add that word in for a while, so that we will increase effective parenting in order to decrease trauma and child maltreatment, is what that now reads. So that is the consolidated new hierarchy, which then leads us to our funding recommendations by result area. By far, the hardest thing that the work group had to grapple with. We had, as I mentioned, considerable input from the community. We applied those funding reductions based on the overall ranking, as well as public input, mitigating factors such as the availability of outside funding. We applied your strategic principles, and we also looked at just the overall size of the investment, because the larger the investment, sometimes the harder it is to not make a deeper cut. These funding recommendations, which are also in your packet as attachment 5, illustrate each of the results rankings from rank number 1, the highest rank, down to rank number 10, the lowest. And then we also gave you, for context, there's information about what the current funding level is, what the recommended decrease is, and what that would result to in funding. And then also some mitigating factors, which also include what the priorities, policy opportunities are. And you will see that there's a new item, which is the very first line item, which covers all result areas, and that's our systems, policy, and sustainability work. So staff are recommending $100,000 each year be allocated to that line item for contracts with our partners, who are critical to our systems and our policy and sustainability work. We didn't have a line item in the current strategic plan, but as you know, we did spend some money on this work. This was our Certified Sustainable initiative. It was also allowed us to partner with the Kings and have our 20th anniversary. So we've been taking from bits and pieces of other places, but I thought it would be important to really say, this is the direction that we're going, and there's a tiny bit of money allocated to that for working with our partners. And then finally, these are our next steps. So we will gather community input after today with our Board of Supervisors, as well as with the community in general. We always bring out our draft strategic plan to parents who aren't already drinking the Kool-Aid, as we say, to parents who are not part of our current programming, to see what they think about what we're funding. And then we will bring this back to you again in May. Well, you'll get it in March as a draft plan, and then in May it will come back to you for approval as a full strategic plan. But by approving the elements today, that gives us what we need to actually draft the real meat and potatoes of the plan. And I'm happy to answer any questions.
Great. Thank you, Julie.
Sure.
Commissioner Elliott?
So, approving these elements, I just want to make sure I understand, does not necessarily mean that we as a commission are in agreement with or comfortable with, like, it's not final. So we'll have the opportunity to work with our stakeholders and work through the process through March and then for approval in May. Is that basic? No?
I would say that the elements in front of you, this is your opportunity to make changes to those elements if you want to, any piece of those 6 items, because that is what gets dropped in. And typically, and this is only my 2nd strategic plan here, but I've done many in a different county. Traditionally, what happens is you might get a slight change to some language or a minor tweak of something, but very rarely does anything major change. So if something is very important to you, I would say this is the opportunity to bring that forward.
Okay. I'll let Steve go and then I'll think through my
Commissioner
comments.
Wirtz?
Thank you. I just wanted to say a couple things about the process, and I think both with our staff and consultants, they provided for the committee a very robust and systematic way for us to approach this. I think the main thing we all feel, and everyone may want to say something about this in general, that this was a very difficult task for us to be undertaking. We've known this for a long time. That doesn't make it any easier when we're talking about cutting from $20 million to 15. That's $5 million, and that does not allow us to say, let's take a little here and a little there. It means making substantial cuts to programs that we understand are critically valuable for our community. And I think, one, we took this very seriously. 2, there is no right way to do this per se. There are many options that were possible for us, but all of them would be undermining some of the services that we provide in the community. However, we looked very hard at where we were leveraging, where our sustainability plan was building strength, and I think I just wanted to say that we were very appreciative of the attendance and the value added of people from the community speaking through these meetings. Again, very hard decisions. We look forward to trying to strengthen the whole community response to this, and I think one of the underlying issues here is First Five has been a real leader in the community, and it's partnered with many of our other county government folks and our incredible community network of organizations, and we're just going to need to continue to strengthen that partnership as we go forward. So because I went through this very difficult kind of task, I just felt like I wanted to say something about the depth of seriousness that we took this and the impact that it has on our community, and we look forward for ways for strengthening our community by bringing more people into the fold through leveraging and sustainability. So thank you.
Commissioner Elliott?
So The first thing that came to mind when I saw this was for result area 1, improve perinatal conditions and decrease infant deaths with a 0% reduction. And then following that, the result area 2, increase prevalence and duration of breastfeeding, a 40% reduction. And, you know, I think lots of studies show that if we were to increase breastfeeding prevalence and the duration of breastfeeding, deaths, infant deaths are impacted by that. And it feels like those go hand in hand. And so I guess my thought is, and curiosity, because I wasn't necessarily a part of that process, would be curiosity around why the 40% and the 0, not like I want to change that or anything. I just, maybe some clarity as to what the thought process is, understanding there is a lot of ways through the Sustainability Committee to fill any gaps and find other sources of funding.
Yep.
So I'm open to that too, of course.
Sure, I can answer a bit, and anyone on the work group can chime in as well. I think where result area 1, which was the decreased child death, was the number 1 priority. And even though it's result area 2, it ranked much lower. So we were really looking at it as the ranking played a big part of it. And there was a cluster of result areas that sort of all ranked toward the top. Okay. And wanting to hold our top priority fully funded because of the amazing outcomes that we're getting in that. Mm-hmm. We looked at, can we get sort of close on the next 3? And so those all were close to about a 25-26% cut. And then we took a big leap off because the next 2 result areas that were kept in the hierarchy scored about the same and much lower, and that resulted in the 40% cut. So the early care and the breastfeeding just overall ranked lower. And I think there's also a genuine hope through the sustainability efforts that those services can and should and will eventually be funded through, they are funded through ACA, but that we will work out the mechanism. And, you know, I know it's critical, and I'm not saying we want to lose those services. It's just, are we the best funder of it? We're here to make sure those services are happening until they can figure out a way to maintain them through other resources. That was some of the thinking behind it.
Okay, thank you.
Commissioner Wagstaff.
Thank you, Mr. Chairman. Julie, thank you for your work on this. And by the way, thank you to the work group, too. You guys put a lot of work into this, and we really appreciate it. I just want to be sure I understand the recommendation you have before us here today, Julie. Excuse me. To begin with, are you recommending to us something different than what you got from the work group in any way? Can you explain that a little bit?
There's a slight difference in what the work group recommended and the recommendations that you see before you today. And that is one area, which is result area 1. The work group had in fact recommended a 22% cut to result area 1. Mm-hmm. And that was, trying to remember the exact dollar amount. Eric, do you have, Carmen, do you remember? We'll get it for you. Oh, $282,000. So that $282,000, just coming from my difficult position and view of the world, and seeing how everything interacts with what we're funding and how it's working and what the impacts are, that's a change that I made. And I took that $282,000 from what we call effective parenting, which in the new hierarchy would be R7.
Sure.
And I took it from there because that, there are many strategies within effective parenting, but one of those strategies is seeing a huge influx in dollars. And so, when we go out for competitive bid, and we're looking at individual strategies, that home visiting dollars can be paid for out of CalWORKs. And it's about $13.4 million over the 3-year strategic plan period. So I took the $282,000 from that pile and moved it back up to our top result area with the highest priority.
So basically, you took into account other resources that are available for that area, and we've talked before about what's coming down from the state for that. So I can appreciate how difficult this is for the group and for you.
It's
I've
rough.
had to do this kind of thing far too many times, but I appreciate your the way you looked at that.
Thank you.
That's very helpful. Thank you.
Thank you.
Commissioner Sneeringer?
Well, first I want to thank the staff and the work group. This is no small task, and I know we've been talking about it a bit in the Sustainability Committee, and I think as a longtime advocate for childcare and early learning programs, I understand the reduction proposed, and I understand the other opportunities on the horizon that were taken into account. That's no small feat. I also really appreciate the idea of moving our kindergarten readiness away from direct preschool services and really taking into account the needs of families getting their children ready for school and all the other social emotional things that need to be taken into consideration. So I think there has been good work done here. None of these cuts are anything anyone wants to do, but just with my lens and knowing what opportunities are on the horizon in a variety of these areas, whether it's home visiting or breastfeeding, I think that there was a lot of thought put into these recommendations, and I just wanted to weigh in and say that I think they really align with the lens of state and federal funding that I see on the horizon.
Thank you.
Thank you. Commissioner Turner-Johnson?
Yes, I also want to say thank you. This has been a really challenging process, I know, and heartfelt by all the people that are on that committee, no doubt about that. I have a similar kind of question. Under the first category of health and R3, which is utilization of medical, dental, and mental health, which is so aligned to your longtime desire and all of us, I think, to get trauma and issues of trauma related specifically to early intervention, you know, is such a wonderful thing to get that going, and you've put it under empowerment. But when I look at the reductions and or proposed 3-year allocations, I'm not seeing any funding under R3. And so, again, knowing what the state budgets look like and what's coming down, are you again thinking there related to the funding for ACEs and various other aspects, that's how these kind of, and dental, of course, and how are you thinking that we'll go forward with that?
So we certainly hope that we get some of that ACEs Aware money into the county. I know SCOE is applying for that, and we've been working with them. And having a tiny bit of money in that result area, it's the policy systems work that we could potentially contract and work with others to bring some of those trainings in for our providers. There's a lot of ACEs work already happening in the county, just maybe not coordinated for our providers. So having it on our radar, having the ability to have a small contract to get some of that happening, and then it's just really directing internal staff's time and our contractors' time to bring in those resources and make sure that we're utilizing everything that's out there for us.
And for medical, are you looking at programmatic that, you know, bring in for developmental screenings and that kind of thing on that aspect?
And for that, we're partnering with SCOE with Help Me Grow, which is doing the ASQ SE, at least as an initial screening starting place. But through our launching of the Sacramento Maternal Mental Health Collaborative, we're talking just about ways where you could screen mom and baby, since the two are a dyad when you're talking about the first 12 months of life. So how can we do some sort of maternal mental health screening along with some developmental screening in the first 12 months? So hopefully being able to work through that new collaborative will allow us to have an impact without funding direct services.
We sure know that there has been a long time coming and too little of any kind of mental health early interventions, but thank you so much for explaining it and for all the work you've been doing, all of you.
Thank you. Thank you.
Okay, I have no other commissioners in the queue. Before we go to public comment, though, let me too express my gratitude to our work group that spent so much time and energy on really trying to vet for us the differences in the kind of terrible decisions that we are being forced to make given the declining budget. So I know it's not easy. I appreciate Commissioner Wirtz's earlier comments about how difficult that is, and it's not just the work group that feels that. I think it's the entire commission. But again, we've known that this is the deck of cards that has been dealt to us and to other first fives across the state. I will say that, and perhaps some of you read an editorial that appeared in the Sacramento Bee last week that I published about the import of Black Child Legacy Campaign. And while that's not noted here by name necessarily, I think you can probably tell in Result Area 1 that there's a lot of intention that is that cross-references with that particular initiative in terms of the intent of this commission to appropriate resources to improve perinatal conditions and decrease infant deaths. But I think it's important not to just consider the spending plan today in a vacuum. This is one of those rare opportunities that we have as a First Five Commission, as a Board of Supervisors, and at the City Council for the City of Sacramento, where we are kind of the three-legged stool, along, of course, with Sierra Health Foundation, who has just been brought all of it together, quite frankly, in terms of the BCLC. But at this early date in February, and of course the city and the county, we begin to deliberate our budgets in May and June. But if this commission isn't going to take a bold decision on spending in a result area that is showing incredible outcomes, and we're going to hear it in item 11 in terms of what the BCLC has been able to accomplish, we actually risk, and to Commissioner Wirtz's earlier point in terms of leveraging, we actually risk having second thoughts by those other governing bodies, and that's something that I am absolutely not interested in doing. So I want to thank the work group for their work, and I want to thank Julie especially for kind of understanding the broader landscape of what this means. I think that's very important, and with that I think we'll go ahead and go to public comment. So again, if you'd like to address the commission on this item, you're welcome to do so. Please see that our clerk and our assistants in the back of chambers get a speaker slip from you. I am going to use the chair's discretion this afternoon. We do have one speaker in particular. I'm going to bring him to the front of the list because I know he's got a very busy schedule, but it's my colleague from the Board of Supervisors, Don Natoli, who's taken time to be here and address the commission.
Well, thank you, Chair Serna, members of the First Five Commission, and Executive Director, Ms. Galileo. I'm very pleased to be able to join with you, and certainly thank the Chair for allowing me to jump the queue a bit. I'm sure there's 16 people that were ahead of me that aren't very happy with that, but I'll try to be brief and to the point. And first, I want to again thank this Commission, certainly with its current makeup, but over the past number of years for its good work. You've done a tremendous amount of the heavy lifting as relates to certainly the focus that this commission brings to the children 0 to 5 in this community, and the resources that then really do partner up with community members and nonprofits and our for-profits, but also our other public agencies. And you've made a tremendous difference in a generation or two of children in this community who are now adults, and many of whom you'll hear from, I'm sure, on this item and the subsequent item this afternoon. And I also want to thank the work group. I know anytime a subcommittee or a committee of the bigger makeup of your complement of your commission is given a task that says you got to go back in and find where to make reductions and cuts, it's no easy task, and certainly one that none of us looks forward to. But I think in light of what has been presented to you today in the strategic plan, as it relates to the elements, obviously it's well thought out. You've put a lot of effort into looking at measures for where those resources go, those precious resources resources, but also what a difference they're making in certainly the lives of children and families here in our Sacramento County communities, up and down, north, south, east, and west in this large county. And I would just note that as you consider the elements here today, and certainly in the months to come as it relates to the adoption of your strategic plan, I think the focus is put on the result areas, and certainly as your chair spoke to a moment ago, as it relates to, I think, a good deal of the emphasis that has gone into, certainly over the last 5 years with the Black Child Legacy Program that you'll hear about in a few moments, but certainly the focus on intervening in an area where the number of deaths among the African American families and community far exceeded what was in other communities, other segments of our community. And I see as my time is already over here, I'll just go to the point that I think your good work has resulted, and the leadership you've shown has resulted in lives saved, and healthier families and healthier children, and certainly adults in this community. And so I want to just speak in support of your strategic plan, your elements as presented here today, and certainly your spending plan. Thank you for your attention here today and for your work ongoing. It's no easy task, but I think you stand strong with partners in this community, certainly the County of Sacramento, the City of Sacramento, Sierra Health, and many others. And so with that being said, Mr. Chair, thank you for the opportunity to address you today.
Thank you, Don, for being here. I greatly appreciate it as a colleague of yours on the board. I know you had the shortest commute to get to this meeting. But I also know how incredibly busy you are trying to address your constituents' concerns over a vast district in a big county. And so it means a lot to me, especially that you take the time to wait and hear our staff presentation and the questions and statements that commissioners have already made. Means a lot to me, so I appreciate your testimony.
Well, I know it's in good hands with the likes of all of you, so thank you very much.
Thank you, Don. Okay. Now, please forgive me if I mispronounce your last name. Kenya Fagbimi?
You said it.
Did I? All right.
Good afternoon.
Good afternoon.
I want to first just say thank you to all of you that have kept perinatal conditions at the forefront, and all the work that you've done. It's truly a blessing to be able to do the work that we do. So I want to, first, I have a poem that I like to share, and I believe this poem is a reflection of the staff and our pregnancy coaches, we call them pregnancy coaches, as well as the clients that we serve. And so this, and I'm not a poet, so bear with me, but I was really inspired to write this, and I think it fits perfectly with who we are as an agency and what we do. So here we go. Her. Who is her? Her is beautiful, her is love. Her is vulnerable, innocence stripped away by the residue of the red line neighborhoods of today. Who is her? Broke but not broken by systemic racism and all the isms and systems that vow to help some but not one. Symptoms of drug addiction, homelessness, teen pregnancy, depression, oppression, domestic violence, sex trafficking. Shall I go on? You know her, hard on the outside, soft in the center. Who is her? The single parent struggling to complete school, put food on her table, and keep her kids out of a system not fit to raise children. Who is her? Her might be you. Her might be me. Her is a pregnancy coach. Her is beautiful, and her is love.
Thank you. Okay, Nicole Davis and LaShanya Brazil. Do we have our speakers here?
Good afternoon, Commissioners. LaShanya Brazil with Her Health First and Black Mother United. I am a pregnancy coach as a doula as well. I want to say thank you, first of all, for allowing the dollars to continue with Black Mothers United. I had experienced preterm labor with my son and his significant other about July of 2019. This little guy here was supposed to be born in October of 2019, but he came in July of 2019. If it had not been for my sisters at Black Mothers United connected with me, letting me know what to do, give me the resources so that I can then go back to the son and the daughter-in-law and convey, you're gonna nurse him, you're gonna pump the milk, you're gonna get through this, we're gonna pray. And miraculously, he made it through. They let him go October 23rd of 2019. And he's grandmother's grandbaby son. As you can see, he's spoiled, keeping his one good eye on me. But like I said, I really appreciate the dollars and I appreciate the support so that we can go out and we can support those mothers so that our babies of color, Black babies, are born healthy, and then we have success stories and we support their mothers as well. So again, thank you.
Thank you. Okay, Yana Walker and Tiffany Wilson. Following Ms. Walker and Ms. Wilson will be, again, I apologize here, Nagoye Helms and Bree Franks. If we could have you kind of queue up as I mention the names, that'll help us go a little faster.
Hi, my name is Ngoyi Helms, and I just prepared a statement. See, I have a little and a toddler. It's hard to keep my wits about me. The racial disparity in Black maternal health and infant mortality is apparent. The system that is the medical institution is killing Black women and Black children at alarming rates, but they are not offering any solutions. Her Health First is a solution. The state wants to discard of these statistics and these women and their children. Treat us like numbers. Treat us like numbers and profit off of our struggles and our pain. Her Health First does not discriminate by class or socioeconomic status, because no matter your status as a Black woman, the results are the same. This informs us that no matter your access to wealth or resources, the problem is institutional racism and implicit biases. If a tree is sick, you can treat the branches all you want, but you won't heal the tree unless you address the roots. The branches are the symptoms that Kenya spoke of in her poem, i.e. homelessness, teen pregnancy, addiction, etc. The roots are underserved and underrepresented communities of color. The roots are underserved and underrepresented communities and communities of Black and brown women with the lack of maternal health education and resources. We have a right to self-determination, and as such, it is our responsibility to do this work. No one else can nor has done it efficiently nor effectively. Her Health First is a group of Black and brown women servicing Black and brown women. You don't need to cut funding or eliminate the program. This program needs to be replicated everywhere that Black people are. We graciously accept the funds allotted for this program, and thank you for your continued support.
Great, thank you.
On that note, excuse me, I'm sorry.
You're Miss Franks?
I'm Miss Gardner.
You're Miss Gardner. Okay.
Tiffany Gardner.
Okay, I got Tiffany Wilson for some reason.
It's Gardner.
Gotcha, all right.
Yeah. But I was one of the first Black African American women to join Her Health First. And I had met my pregnancy advocacy at a liquor store, homeless with my 3 kids at the time, and I was pregnant with my 4th child. And if it wasn't for the grace of God of her turning her car around to even see was there a Black mother at that store, I don't know where I'll be today. I think I'll probably be, continue on doing drugs, continue on selling my body to make sure that.
You're right, you're right. Got it.
To continue on, to sell my body to support my babies and to make sure that they have some type of sort of roof over their head and sleeping at a park and on park benches, and to support them in some type of shape or form. If Miss Tony with an I, if she would have never had stopped me at that liquor store and helped me to nurture and to become the woman that I am for my young, I don't know, I'd probably be right there on that path doing what.
But you're not. You here and you're telling her story.
I'll be on that path right there suffering if these black women didn't come together and have any type of program like this, and to be able to support our young youth and to help our older youth to even grow into a better person that they are. Then I'm just grateful. I'm grateful that y'all fund the program and that it's here for us to reach out and grab and get the support that we need when we don't have nobody like our family members to support us. They is like me and my kids' family, and I greatly appreciate these women.
Hey, Tiffany. Great job.
Thank you.
Okay, and you are?
Brittany Franks.
Okay, I've got a bunch of cards that have multiple names. It makes it a little difficult to manage. Just make sure that you fill out a speaker slip if you haven't already done
It's up
that.
there, you call my name.
Okay.
Bree, yeah.
Bree, okay, gotcha. Go ahead.
Okay, just a second. Let me pull up a note. Sorry, I'm kind of nervous. I'm not a public speaker. But I wrote down, to be involved with a community-based organization that focuses on providing necessary support and bonding with other Black women and correct programming is such a beautiful, powerful source to have access to. Going through groups and engaging with other moms that I can personally relate to gives me a sense of ownership, safety, a place to confide, and receive what we lack, which is support within our community. A lot of us don't have, the resources that we need in our own families, and we turn to programs like these to help us and make us family. And becoming a member of this community is just really powerful, and I really appreciate being a part of BMU.
Great.
Thank you.
Thank you.
Hi, my name is Ayana Stanley, and I attend Black Mothers United / Her Health First. I'm kind of nervous, so give me a second. This program has really changed my entire life. And the woman standing next to me has helped me tremendously through everything I could. If it wasn't part of this program, I don't think I would have had my child. I was in a state of mind of I wasn't going to be a good mother. I wasn't going to take care of my son the way that everybody wanted me to. In this program, I tell you, it changes so many Black women's lives, I tell you. And every time I'm with them, it's not even Black Mothers United, it's like a sisterhood. Everyone talks about everything, how they feel, what they're going through. It's nothing hidden back. When we talk truthfully. There isn't no, oh, this is how we feel and we hide it. We let everything go, everything. And my son is my life. And I'm so happy for this program because, like I said, if it wasn't for this program, I wouldn't have had him. And there's times where I get frustrated, and there's times where I want to give up. But every time that I give up, I hear this lady on the phone every single day, you need to get up and you need to go to work and you need to do what you got to do. Because can't nobody provide for your son but yourself. And if you can't provide for your son, then no one else will, and then that's when they get put into the foster care program. And I'm a foster myself. And I tell you now, going through foster care is no fun. Jumping from house to house to house to house with no stable home, it's no fun, I promise you. And I'm really happy that being in this program, that I was able to get everything I needed done, taken care of. Whatever I was supposed to do, I did it. So thank you.
Thank you. Okay, Shannon Shaw. And following Shannon will be Tiffany Davidson.
Good afternoon. Shannon Shaw with Her Health First. You've had an opportunity to hear our stories, and I ask that our moms that are here with us please stand. They're already standing, even better, like we could have queued that up. You know, I just want to thank the Commission, First Five, and the committee for not recommending a cut to this area, because a cut to this area would have meant that we would have had to choose from those women who are standing and turn them away. And where would they go? You know, this is an age-old story, right? We see an issue and it comes up and we get the wherewithal, you know, the data to support throwing some money at it and starting some programs. Then we start to see a little bit of a shift and we start to see improvements and we say, oh, this could be another area where we can cut now. We're doing something right. We can pull the funding away. But that's not the case here. And, you know, some of these issues that continue to perpetuate the social determinants of health, the systemic barriers, racism that exists, that continues to cause stress for our moms. So, Commissioners, you have this opportunity to rewrite that story and to continue funding this incredibly important area. And as a result, your leadership will save the lives of babies. Thank you.
Thanks, Shannon. Tiffany Davidson. And following Ms. Davidson will be Morgan Hamer.
Good afternoon. My name is Tiffany Davidson, and I'm here representing the 9 school districts who have received funding from First Five Sacramento. These are some of my colleagues. This support has allowed us to provide crucial services to some of our most vulnerable families and children. During the 18-19 school year, we served 4,796 children and 4,083 parents and caregivers. We have provided a range of services at 46 sites throughout Sacramento County. This includes, but is not limited to, developmental playgroups, early literacy workshops, parent education classes, kindergarten transition summer camps, and activities for adults so that they can support their children transitioning into kindergarten. Families participating in our programs report reading more to their children, better connections to their community, and an increased knowledge about support services. We provided a total of 11,956 screenings to children in order to provide early interventions. All of this work is being done to support children's success in school. We would like to thank you for your past support and are counting on your continued support, which allows us to provide much needed services to our families. Thank you.
Great, thank you. Morgan Hamer.
Hello, my name is Morgan Hamer, and I am the director of Stepping Stone School at River Life, a nonprofit center-based preschool serving 55 children in the East Sacramento community. I would like to thank the Commission for offering and funding the Preschool Bridges Model Plus program. My center has participated in the PBM Plus program for 2.5 years, and the benefits to my program are countless. With the support of PBM Plus, we are able to identify children with developmental delays using the ages and stages questionnaires provided to us by PBM Plus. We are also able to refer and identify children and families for support and services throughout the Sacramento community. With the coaching from my ECE specialist, Lindsay Fredemeyer, I have become a better director to my staff and my center. Her coaches and endless teaching and guidance for me has changed my center tremendously. It's important to keep programs like PBM Plus available so that children, families, and programs continue to have the support needed to raise the quality of care for our families in Sacramento County. Thank you.
Thank you. Paula Martinez. And then following Ms. Martinez will be Nelia Pislering.
Hi, good afternoon. My name is Paula Martinez, and I'm the director at Wonderland Christian Preschool and Daycare. We currently serve 70 children with a total of 33 children ages 2 to 5 and their families that live in the Carmichael area and surrounding areas. Before I give a brief description of my experience with PBM Plus, I want to say thank you so very much, First 5 commissioners, for the continued funding of this valuable program. So just to give you a quick inside track, 'cause I know my time is ticking, I became a first-time director as of July 1st of 2019, and as if that wasn't enough, I believe that all great leaders or directors know that they do not know everything. So I needed to be in a program that would coach me, that would mentor me, and it was to my surprise and a great benefit that I found out about PBM Plus. And if that wasn't enough already, a month later after I became a director, I actually suffered a personal loss. I lost my mother, which with being a director and a leader of a school, you need mental clarity, and I was not in a good space. Having my coach, my ECE specialist and coach, Rachel, she came in and she was able to basically help me to refocus and to keep the program going. The families benefited, the children, the team. It was I can't even express. I mean, it makes me so emotional to think about it. That without this program, in all honesty, I don't know where our program would be. And right now, it's thriving. We are using the ASQs with the children now. We are, my toddler team is in with Rachel too, and they weren't new teachers, but they were new to the toddler room. And so she was able to coach them to be able to create a great toddler program. So I just want to say thank you again, and I urge you to please continue to fund this program. Thank you so much.
Great, thank you. And you're going to have to correct me on your last name pronunciation. Sorry.
Hello, that was all right. My name is Nelia, and I am a mother of 7 kids. And my 5 kids, we were praying for twins, and God blessed us with twins. They're 5 weeks old, and they were born 34 weeks premature, and they were in an ICU for 3 weeks. And when it was time for come home, all my 5 kids got sick. They had fever, and they were coughing and everything, like cold season, flu season. And when I came home, I was like so upset, and I thought, oh wow, they were in NICU for 3 weeks, and I just brought them home, and my other kids get sick. And I called to my lactation consultant in the WIC program. And I said to her, you know what, I want to breastfeed them, and they are 2 kids, so I don't know how to do to give them my best, you know, and I don't know how much they get from me. And she told, no worries, just come, I will see you in 1 hour. And I came and she weighed them and I breastfed them. She told me how much did they eat from me. I was worried a lot about this because you don't know how much your child gets from you. And because I gave to them breast milk, and she was big support for me to go through this time, my kids, they did not get sick. They stayed healthy, and right now they're 5 weeks, and I so appreciate for this big support from WIC program, from lactation consultant, especially for premature kids. And I, as a mother, I was so happy, and she follow up with me. She used to call me every day, how is things going, how is babies doing, and it was big support for me, even though my husband is biggest support for me and my family. But it was very I'm so happy that we have services like this for mothers, and I couldn't afford for myself maybe to go and pay for 100 or 150 to just get some help from other services. Thank you so much. I appreciate, and I think that you will keep this services, and thank you so much.
Thank you.
Hello, afternoon. I don't have a twin. I don't have premature, but I have a baby, almost 4 months old. It's my second baby, between 19 years at CAP, so I'm pretty much a new mom. So the long story short, I was born and gave a baby in a Kaiser, and my baby was getting air when I gave him a breastfeeding. That's the problem. He was at so much pain. He cannot sleep. He cannot rest. So I seek for the help. I went to Kaiser. I have a Kaiser, so got a lactation consultant. Didn't help. I don't have they have a limited time to listen to customers and clients, but I have so much struggle. Then I found out that WIC has a lactation consultant, and I came down and make an appointment. It go through me 4 months strong. My baby hasn't had any extra supplement, anything of breastfeeding. So they taught me how to breastfeed, how to taking care of baby, everything they taught me was all breastfeeding. Because the breastfeeding, the program you guys give an opportunity, that my baby is 4 months strong, still breastfeeding, no sick, nothing, is a very healthy baby. Almost, he was born in 9 pounds. He's almost 20 pounds now because of breastfeeding. So I'm barely holding him right now because I cannot, it's very heavy. So my background, what happens is I come from Mongolia. All my parents are outside of country. So my husband's job is required to travel. So basically he and me home all day and night and alone. Jeanette is there. She was helping me so much. I'm so appreciated. You can make your decision wisely. Breastfeeding is the most important. The baby is not taking a breastfeeding. That's the cause of sickness and everything. My daughter is 19 years old, breastfeeding all the way 1 year. That's what we do in overseas. So everything is because of breastfeeding. Just thank you for the time.
Did you fill out a speaker slip?
I'm sorry?
Did you fill out a speaker slip?
Yes, I did.
Okay, are there others behind you that expect to speak?
Yeah, they all filled out speakers slips. We just did it like this so it goes faster.
Okay, well, it's very confusing. I'm sorry. I need to know the order because I want to be fair to people that got their speaker slips in. So, what was your name?
My name is Ari.
Okay.
Ari Danjan.
Okay, and who's next? Okay, thank you.
Well, good afternoon, Commission. There should be a picture that's being passed around, and it has a picture of a baby infant on it. And so that's what I will be sharing with you guys today. My name is Pa Zhang, and I'm a breastfeeding parent counselor, and I provide mom-to-mom support through CRP WIC. I want to share my story about helping a mom with breastfeeding. Grace and baby John had a challenging situation that really helped me to see what First 5 can do to help moms in need. Grace, a first-time mom, couldn't latch her baby and did not have transportation to get to the WIC office. But because the First 5 grant allows our lactation consultants to do home visits, our South Area lactation consultant, Yang, and I were able to go to Grace's home. When we got to her house, I was shocked to see her baby looked so thin and weak. And in the paper, you'll see how baby John looked like. I was scared and unsure of what to do, but Yang realized that Grace had no idea her baby was in such danger. Baby John was not transferring milk from the breast. We even attempted to give him formula, but he couldn't suck the bottle. Through Yang's assessment, she instructed Mom that baby John needed immediate medical attention, so we made arrangements for her to get to the hospital. Some of you may have heard Grace's story at the last Strategic Planning Committee meeting. She couldn't be here herself, but what she did say, and want to make sure that I repeat it, is that if I and Yang did not go to that home visit that First 5 allows in providing services, her baby could have died. After he got the care that he needed, he is a thriving and energetic 18-month-old. This is more than luck. This is the power that First 5 can do. As a parent counselor, it is out of my scope to help with high-risk breastfeeding cases like this. So I am very thankful that First 5 made it possible to have LCs like Yang to be there with me. I see so many moms that are very appreciative of the help that First 5 provides to make sure that they can help keep their babies healthy by succeeding in breastfeeding. Thank you for listening to my story.
Thank you. Okay.
Samantha Slaughter.
Okay, Samantha Slaughter, you're up. And then Jeanette.
Lisa and then Jeanette.
Great, thank you. Good afternoon. My name is Samantha Slaughter. I'm a First 5 funded lactation consultant and WIC regional breastfeeding liaison. Currently, the First 5 funded LCs are the sole source of skilled lactation support for Medi-Cal families and their healthcare providers in Sacramento. We're working diligently on a sustainability plan and have promising partnerships that we are working on, but this is a slow process due to the nature of the healthcare system, despite the fact that ACA has mandated lactation services for the past 10 years. If our funding was cut beyond the previously expected 30%, it would jeopardize these sustainability efforts and have a detrimental impact on our county breastfeeding data, perpetuate the breastfeeding and health disparities we're working hard to address, and negatively impact other First 5 priority areas, namely infant death, improving perinatal outcomes, child maltreatment, and maternal mental health. I'll leave you briefly with a personal account of an impact, highlighting the impact our work can have. I worked with a mother named Alexis who just walked into the WIC office requesting to see a lactation consultant. She was worried about her 5-week-old daughter Isabel and was frustrated by her pediatrician's lack of concern. I quickly could see that her concerns were valid. Her baby was extremely thin and had very noticeable stridor when breathing. Through my assessment, I found that her baby likely had both tracheomalacia and a tongue tie, making it nearly impossible for her to get enough to eat, resulting in failure to thrive. Because of our First 5 funding, I was able to keep in close contact with this dyad through home visits, as well as accompanying her to the baby's doctor's appointments to help advocate for the baby's health and well-being. We established a feeding plan, and Isabel quickly began gaining weight. Nearly 4 years later, I'm still in touch with this mother, who through working with me felt empowered as a person and a mother in advocating for her daughter's health. Thank you for your continued support that allows us to be an important resource for our families in the Sacramento community.
Thank you.
Good afternoon, Commissioners. Thank you so much for this opportunity. My name is Jeanette Newman-Velez, and I'm the Breastfeeding Promotion Coordinator at Community Resource Project WIC, one of 2 WIC agencies in Sacramento County that serves the needy population. What I'd like to bring to you is that A little bit about your legacy. Your legacy made it important to have breastfeeding be a priority area. We know reading's important. We know making sure that families have connections is important, that we can help mothers to make sure that if they're getting depressed or they're having issues that they need, we know that those things are important to do, but the magic is that breastfeeding touches all of those other priority areas. And my concern is that if the Strategic Planning Committee's funding recommendations are enacted, it will not allow the priority area of breastfeeding to really have full force. We touch so many of these things, preventing child abuse. When a breastfeeding mother is breastfeeding, her baby's less likely to be abused. When a mother is breastfeeding, in case that baby was born early, that baby has a higher chance of living because of what's in the breast milk to mitigate, just like as our mom had talked about her twins being born early. And if a mother is under stress, breastfeeding and breast milk, the whole hormonal action helps her feel calm despite all the chaos that's going on in her life. So again, my concern is if it is in fact decreased to that amount, it will be a problem. We talked, there was a little bit of a discussion about ACA, Affordable Care Act. The Affordable Care Act was passed 10 years ago. And just now, still, companies like different insurance programs and independent professional associations are in the process of developing that. So we're concerned that if that funding goes to such low levels, it takes away the integrity of our program, and all the progress that the commission has made will pretty much be, I don't want to say wiped out, but getting to the point where we can't keep that up. We are making connections with our partners. We work with Her Health First, we work with our community partners. We're trying to reach the moms that also need that because, as you may know, African American babies have the lowest rate of breastfeeding. And African American mothers have so many challenges to sometimes get to us. We're trying to touch on that. I am concerned that if that funding level goes down, the progress that we made will not continue. So, in short...
Can you wrap up, please?
Yes, in short, thank you so much for your time. Thank you so much for keeping that perspective. I appreciate it.
Thank you, Jeanette. You're Lisa?
Yes.
Okay.
Good afternoon, Commissioners. My name is Lisa Matthews, the Breastfeeding Program Coordinator with the Sacramento County WIC program. Today, I'd like to address the proposed 40% reduction to the breastfeeding result area. As you've heard previously, there are significant gaps in our community with regards to breastfeeding support, and many of the families in our community come to WIC, even those that aren't on WIC, access our services because there is a lack in our community. The proposed 40% reduction would lead to approximately 55% reduction in lactation consultant services because there are some program costs that we are not able to reduce at the same rate. So that would mean, as an example, 700 mothers per year would not be able to access breastfeeding support services through lactation consultation, and also approximately 920 consultations would not be available or not provided annually over one fiscal year. As mentioned by Julie and Jeanette earlier, both Community Resource Project WIC and Sacramento County WIC are working on reimbursement pilot with independent physician associations, and this is part of our sustainability plan. What we've seen so far is about 30% of the consults that we are doing are being able to be reimbursed. So I would like to request that the Commission reevaluate the percentage of the reduction to have it be closer to the 30% reduction, because that is partly what we had planned for in our sustainability plan. Thank you so much for your consideration and your ongoing support.
Thank you. So before I call the next speaker, Julie, I suspect that when public testimony is concluded, you have a question from at least one commissioner, myself, about kind of this color of money question when it comes to WIC in particular. I know you made mention of it earlier in response to Commissioner Wagstaff, but I think it needs to maybe be explain in a little greater detail. And by that I mean, what other opportunities are there for funding besides that which comes from this commission that could keep WIC whole?
Okay, thank you.
All right, Stephen Orkin.
Commissioners and Julie, I am Stephen Orkin. I'm a retired physician, and I'm currently a member of the Public Health Advisory Board and also the Human Services Coordinating Council. I think you've heard testimony so far of the power of the first 5 programs, and of course you know those well. I'm aware of the financial constraints that have been already described, and I'm also impressed by the thoughtful way that you've attempted to create, to prioritize as reflected in the hierarchies that you've established. But I do want to mention that I think that your severe funding cuts, that's 40%, in relatively inexpensive breastfeeding programs, is short-sighted. And I don't have to tell this board that breastfeeding is foundational to a healthy childhood and beyond. And you've already heard some discussion of the impact on the need for subsequent services if there is successful breastfeeding. You're aware of the health benefits, but also of the behavioral benefits that accrue from successful breastfeeding. I've been most impressed by the numbers of people that have been encouraged and have successfully become breastfeeders when their children come along. If you're not fully able to fund and grow a program that aggressively promotes breastfeeding, then I think it's incumbent upon this board to find alternate ways to find the funding to support these programs. The health plans that are Medi-Cal providers are all promoting breastfeeding. They should be supporting these efforts either through their community giving programs, which they're required to do, or they should be charged for the services that are provided. So I think there are alternative ways of funding these programs. It'll take some work, but I think you should not take a drastic step at this point of a 40% cut, because you may end up with loss of personnel that are really important aspects of this program. Thank you.
Thank you. Okay, Robert Sanger. Following Mr. Sanger will be Jocelyn Bird.
Good afternoon, Supervisor Cerna and Commission members. My name is Robert Sanger, and I'm the Executive Director for the Folsom Cordova Community Partnership. We are one of the 9 family resource centers in the Birth and Beyond program, and I am also the chair of the Birth and Beyond Collaborative. First, I would like to thank the Strategic Planning Work Group and staff for their work on the strategic plan and the difficult decisions that they had to make to create these recommendations. I would like to take a moment to address the percentage of cut to the effective parenting strategy area and what we understand to be part of the philosophy for the higher cut percentage in the list of priority areas. It is our understanding that the reason for the higher percentage cut is because of the amount of additional home visitation monies through CalWORK's home visitation dollars secured through the Birth and Beyond as part of our sustainability work. I would like to let the Commission know that even though there are CalWORK's home visitation dollars, these are not apple-to-apple dollars with first $5. The CalWORK's home visitation dollars have limitations. The CalWORK's home visitation dollars are only for families with children 0 to 2, or with families with children 0 to 2 of age, and the family has to be participating in CalWORK's in order to be eligible for that program. This would create a situation where families will be left behind because they don't qualify for that eligibility. And one of the examples of that is at the Strategic Planning Work Group, there was a family that came in from La Familia's Family Resource Center, and she shared her story of engaging in the home visitation program as well as the Family Resource Center and the deep impacts that made on her family. Under the CalWorks home visitation dollars, she wouldn't have been eligible for participating in those programs. I would also like to share with the Commission that the threats to the home visitation funding continues with the loss of Title IV-E waiver dollars to Sacramento County. So I just want to take the opportunity to share that with the Commission, and I want to thank you for your time in making these difficult decisions.
Thank you. Okay. Jocelyn Bird, and following Ms. Bird will be Siobhan Stills.
Hello, good afternoon. My name is Jocelyn Bird. I am the owner and operator of a family childcare in the North Natomas area. I service families with children ages 2 to 10 years old. I currently have 19 enrolled children, and I am a part of the preschool bridging model program. I would first like to thank the first 5 commissioners for funding the preschool bridging model program. It has helped me grow tremendously as a staple business owner within my community and assist my staff members, enrolled families, and children with endless resources. Because of my amazing coach, Beth Sievers, and her persistence of helping me learn and incorporate the ages and stages questionnaires into my early childhood program, I am now able to quickly identify any concerns within my students and provide them with the appropriate support they may need. 2 years ago, we were able to encourage one of my clients to take her preschooler to get an evaluation with her pediatrician after scoring significantly low in the social emotional section of the ASQ. We all thought that she was just going through her 2-year-old temper tantrums, as most 2-year-olds do. However, after speaking with her pediatrician and having additional screenings done, she was diagnosed with high-functioning autism. With the continuous support of the PBM program, this child was able to have an on-site behavioral specialist and direct tools that help her blossom and thrive within my program. Without the ASQ screening, I'm not sure if we would have been able to catch it so early on, so she was able to get the support that she needed. The PBM program has made a huge difference within myself as a staple business owner and with my enrolled families as well as my children. And I just encourage for it continually to be supported, and I thank you for your time.
Great, thank you.
Thanks.
Siobhan Stills?
Ms. Siobhan needed to return to her family child care.
Okay. Christine Smith.
Good afternoon, Chair Cerna and Commission members. I am Christine Smith. I'm a director of the Early Learning Department in the Sacramento County Office of Education, and I'm here today speaking on behalf of the Preschool Bridging Model, which is part of the High Quality Early Learning Result Area 5. I'd like to begin by thanking the Commission for their investment in high quality early learning throughout the years, and remind you that past investments in the preschool bridging model have positioned Sacramento County to draw down quality improvement funds from both the California Department of Education and First 5 California. First 5 Sacramento dollars can serve as a match for First 5 impact quality dollars and are essential to draw down the maximum funding. A $1 investment from First 5 Sacramento leverages $2 of impact funding to support quality early learning. Continuing your investment in Result Area 5 and Preschool Bridging Model Plus is critical. Children may spend up to 12 hours per day in an early learning and care setting, and research has shown that a high-quality early learning setting is an essential foundational component for a child's school readiness as well as their lifetime success. Family child care homes and private centers that are served through Preschool Bridging Model Plus are those high-quality settings. First Five's support of high-quality early learning ensures that children have high-quality educational experiences in the centers and family child care homes when they're not with their families. Your current investment supports direct support for the providers and their families, which enhance and expands access to quality improvement to family child care home and private centers. During the first quarter of this year, our ECE specialists were able to connect with 115 teachers and professionals working with children, and that's over 1,637 children, birth through 5, that have been supported through this quality work. 84% of those providers are in the high priority LPC zip code zones, serving high-risk families. So I'm here today to strongly encourage the Commission to reinvest in preschool bridging model and its benefits to our county's children's families and early learning professionals. And we hope that we know that you have a lot of hard decisions, and for us a 40% cut is a large cut, but we hope you do consider to move forward with your strategic plan recommendations. Thank you.
Thank you. All right, our last speaker is Robin Blanksguster.
Good afternoon. My name is Robin Blanksguster, and I'm a retired teacher and nurse and have my hands in a lot of voluntary boards and commissions. I just wanted to say that I support the First Five strategic plan, and I do know that their dental plans, they've been stepping up. They have early smiles and other types of plans that they are doing with the schools so that they are covering all of the kids, so that they are a partner with these different ones. My other thing was just that with everything going on, the child legacy and stuff, I really hope that you take into account that our Black infants, our people needing child care, that the monies that you have supplied so far, they have done an extraordinary amount of good. I've lived here all my life. I'm a senior, so I've lived and seen it all. And to know and see how much we've come through and the things that we have gotten through, how much these programs have done, even in the last 10 years, is amazing. And I know that you guys have a hard job, and I really don't want to be you. But I really, really do hope that you take into account what each of these programs really need to sustain and to go forward. Thank you.
Great, thank you. Okay, is there anyone else that would like to address the Commission on item number 10? Okay, not seeing anyone approaching the podium. I appreciate everyone that took time again to address the Commission on this item. At this point, I would prefer to have a discussion and ultimately a vote on this important subject with a full complement of principal commissioners here. And seeing that for whatever reason Mr. Wagstaff has stepped away from the dais has me a little concerned. So what I'm going to do, Chair's prerogative, we're going to take a 5-minute recess. We're going to track down Mr. Wagstaff so that we have that full complement and have an ability to have a good discussion and ultimately a vote. Thank you. Yeah, I'd like to call back to order this meeting of the Sacramento First Five Commission. Madam Clerk, will you please call the roll and reestablish a quorum?
Chair Cerna?
Here.
Christina Elliott? Here. Eric Fernandez Garcia?
Here.
David Gordon?
Here.
Olivia Casserier?
Here.
Bruce Wagstaff?
Here.
Steve Wertz?
Here.
Patrick Kennedy? Beth Hassett? Here. Lee Turner Johnson?
Here.
Donna Sneeringer? Here. Terry Porter?
Here.
Scott Moak?
Here. All right, I believe we have the full complement of where we started. That's progress, so I appreciate everyone coming back to the dais for discussion and a vote here. I did ask a question of Julie in the middle of public testimony, and I guess what I'll do is get that response from her now, and certainly commissioners are welcome to chime in on that subject. But I do have Commissioner Wagstaff in the queue to make a comment or ask questions. But why don't you address the color of money issue I raised earlier?
Sure, and I feel like we've been here before when we were making reductions during the first fiscal cliff. We did have a higher reduction rate for breastfeeding, and one of the reasons why we turned that to less of a reduction was to give them some additional time to work on the sustainability, because it is a tough one to get to. We were also really concerned about ACA changes and what was going to happen during that time with the new administration at the federal level. And we do still have one challenge, which is around IBCLC, so Internationally Board Certified Lactation Consultants in the state of California cannot bill directly for services unless they are either overseen or are also an IBCLC who's also a registered nurse or a physician's assistant. It has to be a higher level. That's something that our First Five Association is aware of. I'm sure the WIC Association is aware of and is working on that, State WIC Association. And starting this pilot that I mentioned with River City Medical Group is something that they're doing during this contracting period to try to establish a workaround, if you will, a different way. So there are some things that I think have the potential to be fixed. Will they be fixed in 18 months' time? I don't know the answer to that. I know that they're working on it. So there's no simple answer to it, but it's of paramount importance.
No, I appreciate that. Are there any other First Fives across the state who perhaps face this potential cut in breastfeeding services, especially with partnership with WIC, that were able to bridge a funding gap without a pause?
I don't know the answer to that. I would have to ask around. There actually aren't that many commissions that fund IBCLCs across the state, believe it or not. This is a legacy. This is something that First Five Sacramento began, I think, was one of the very first funded programs out the gate, and we have made it a huge priority. But I don't know. I think it's fair to say that there are a handful of other commissions that fund this work.
Okay. Do commissioners have any questions or reaction to this particular part of what the public provided in terms of testimony? Okay, hearing none. Commissioner Wagstaff?
Yes, thank you, Mr. Chairman, and apologies to everybody for having to scoot out of here on another issue very quickly. But I do think, Julie, to your comments just now, it would be useful to check with some of the First Five commissions to see if they have discovered other ways of covering that. I'm very sensitive to the kinds of decisions that had to be made here. I want to thank again the work group for their input and their time they committed to this. And I know that the calls were difficult, but Mr. Chairman, I think Julie's thought process on this makes a lot of sense, and I'd like to move the staff recommendation.
Okay, it's been moved by Commissioner Wagstaff. Is there a second? Chair will second. Further conversation?
I'd like to say something.
Okay.
Just really quickly. I mean, I don't want to belabor this. I think that, we've all are not going to enjoy what we're going to have to do here in a minute, but I would say that, really, I think going forward, one of the things that I really want to focus on as a commission and in the sustainability committee especially is what are the priorities of our commission moving into this different financial landscape. And I'm not the type of person to continue to fund something just because we funded it first. Right. That being said, I also think that breastfeeding is one of the most important things that a woman and an infant can do together, and I think it's foundation setting. I'm gonna hope that we can figure out new ways to partner with our folks that are being funded in this first priority R1, and find out what those links are. I'll say for myself, this doesn't necessarily reflect what my priorities are, but I respect the process that this committee went through, that the subcommittee went through, and I also want to thank, I don't want to sound, like I'm not thankful for that process and that those hard conversations that were had. So I think that with everything that's taken place and the diligence that, this work group went through, I support it. And I just think we need to figure out where breastfeeding stands in our priority list, because right now, I guess I'm a little bit confused about how it ended up ranking that, not confused, concerned about how it ended up ranking so low on the priority list. What does that mean? I don't think that's to be figured out here, but I just wanted to take the opportunity to say that that's a concern I have, and I want to understand that and figure that out over the next 12 months and what we can do as a commission.
Thank you. Commissioner Wirtz?
Thank you. A couple comments and questions. The first, my understanding is that in the breastfeeding domain, we're talking about funding around nearly $500,000 per year. To take that cut up to, or from 40% to less than that, 30%, would be about $50,000. So I think we're talking, that's the, for per year. That's the first question. It was $630, it's now $450, that's about $180 divided by 3.
We did some quick math, and to get it to about 30% is, we came up with $80,000 per year. An $80,000 increase would bring it from a 40% to a 30% cut.
Okay, thank you for the clarification. I appreciate that. My quick math was not
It's
as
okay.
good. So one, I wanted to put that out there. That's the amount we're talking about if someone were to make a suggestion of switching from 40 to 30. So then I have two questions, both about leveraging.
Yes.
Well, first of all, one further comment on the breastfeeding. I'm hoping that in Sacramento County, with our 4 or so major health systems and our hospitals, that we as a commission can urge those hospitals to take on the role of supporting breastfeeding as they should, as part of a care system. And I know that the Baby Friendly Hospital program is around and working in several of these hospitals, but I don't see why they couldn't come up between 4 hospitals that are massive organizations, that they couldn't come up with the 80,000 among them to solve this problem. So that's one thing about leveraging. I'm hoping that our sustainability approach works like that we take leaders in our community and we talk with the leaders of those organizations and stress how this is part of a broader system of care. Which I just want to say that my perspective, from a public health perspective, is around the multiple social and economic determinants of health. And all of these are intertwined. A woman can't succeed with breastfeeding if her family is going hungry. They can't succeed if they're homeless. There are a lot of challenges that are intertwined. They can't succeed if their baby is too premature and so on. We've seen successes as well. So I just want to point out that we're dealing with a variety of risk factors and a variety of protective factors to try to build the best structure we can in Sacramento to help our families, and that includes having parents know how to be effective parents and our schools to be ready for them and so on. So I just contextually want to say that as well. The two leveraging questions I have, one is around the bridging model about the drawing down of one's first $5 for every 2 matching funds from the state. I'm wondering, I thought perhaps incorrectly that as we discussed this, that there was a cap to how much could be drawn down, and that we were still going to be drawing down the close to or the full amount of that. And should I take the question separately and let you?
Sure.
Okay.
So for that, correct. When we were at the work group meeting, we did not yet know the allocation for Sacramento, nor how much we were going to need for drawing to match it to draw down the full amount.
Yeah.
We've subsequently found out it's a little over $1 million a year, but I was under the impression that about $510,000 per year had to be our minimum match to draw down the full amount.
Right.
So, and that information came in afterward, and I'm just going to look to Lindsay to confirm that is the number, $510,000 match for annually. Yes.
And that means that we are going to draw that down?
Yes.
Yeah, okay. So that makes me feel better that we were thinking through this in the way that we thought we were.
Yep.
The second has to do with the home visitation and the CalWorks piece. And I understand that important to differentiate the criteria, that CalWorks is a limited and constrained program in several ways that impact the ability of us serving all our families that we would want to. However, I'm assuming that our goal would be that we would draw down CalWorks money for whenever there was a family that could be fit under that category, and that we would use the additional First Five funds to cover families who didn't match that criteria. And maybe you could just say something about the balance. First of all, there's work to be done fiscally to make that happen. And then second, there's the question of how differential the loss that we think this cut, 26% cut, would represent.
Sure. Thank you for that question. So, and you heard Robert Sanger from Folsom Community Partnership talk about sort of the concern around the CalWorks money. And that concern is real right now because the model that our contractors are using is called Healthy Families America, and it limits the children and families who can participate to a woman has to be pregnant or have a child up to 3 months of age in order to be eligible for the program and be on CalWorks or be CalWorks eligible. So limiting to just that one model does in fact limit the population, but there is no guidelines that limit to that. So in other words, within the next 18 months, we would anticipate when they have to reapply for the funding that they would apply for maybe Healthy Families America and a model such as Parents as Teachers, so that there's multiple models run so that a child comes in at any age, they can receive home visiting services. That's the recommendation from First Five, and I think that it just makes good financial sense and sustainability sense. Currently, 85 to 90% of the clients served by our Birth and Beyond program, which is the current CalWorks program as well, are either CalWorks, on CalWorks, or CalWorks eligible. So there is about 10 to 15% of clients who, I would agree with you, we absolutely need to keep our foot in the home visiting door for specific clients who cannot be seen with CalWorks home visiting dollars. Mm-hmm. That's why we need at least a percentage of our strategy to continue to fund home visiting. But if the new models are successful, then a pregnant woman through a child age 5 who's on CalWorks or CalWorks eligible would be able to take advantage of a home visiting program. And that would then draw down the $13.4 million.
If you're, Mr. Chairman, all right to continue?
Yeah.
If a family is on through CalWorks through 2, does CalWorks continue to fund that family onward? So it's the eligibility and start of the program that puts them on CalWorks funds, and then they can stay on CalWorks funds or not?
You mean CalWorks home visiting funds?
Yes.
Home visiting funds. So it really depends on the model. So Healthy Families America only goes to age 2. So even if they got on at 3 months, they'd still have to get off at 24 months.
Yeah, got it. Okay.
So you need a program like Parents as Teachers or another evidence-based model that you can select from. And Robert was correct. There are 2 funded programs right now. One, Healthy Families America, and the other is Nurse Family Partnership, which is run through Dr. Cassirier's shop. Both of them have the exact same target population, pregnant through 3 months of age, to be eligible to enroll, to be served through 24 months. So you can see that we need to expand in order to fully make use of all of those funds.
Right.
And there's 17 months to get to the point where we can do that. So I think it's reasonable to assume that we could launch something new.
Great. And I think then the other critical thing from the evaluation side of things is that we use, when we expand those programs, we look at those effectiveness for our populations and choose programs that are likely to be successful with our population in the community. The other question is, so the Nurse Family Partnership is funded through the county?
It's funded through CalWORKs as well, but not through CalWORKs dollars that come through First Five. So that $13.4 million does not include CalWORKs money coming in for home visiting that goes through the Department of Health Services.
Right.
It's just the expected funding that would filter through First Five to go out to community partners.
Got it. And I guess this is a generic question. Are we drawing down, or is there any way that the county can expand the support for the Nurse Family Partnership? Is that all coming from CalWORKs funds, or is there a way that the county could consider the leveraging and sustainability of this gap in potential families served? Nurse Family Partnership is also only up till 2 years as well, right? So, all right, I think that takes, the gap is then from 2 to 5, as well as our extended ages for Department of Healthcare Services. And right now, the only way to do that will be to take this 18 months, plan around other programs that serve the families effectively for 2 to 5-year-old children.
Correct. And I think one thing that's going to be key in that is as we get some new funding from First Five California around home visiting coordination, that's a perfect thing to look at over the next 18 months.
Yeah.
Which departments are doing what type of home visiting for which populations, who's covered, who isn't covered, how do we maximize drawing down money? All of that is the first and foremost work of this new home visiting collaborative that we'll be putting together through First Five.
Thank you for indulging.
Dr. Kassiri.
Thank you. Just to explain also about Nurse Family Partnership, all the funding we get, most of it is actually federal and state, and then recently we coordinated with Department of Human Assistance to get an additional team that is going to serve the population that you are talking about. But there is no county funding in Nurse Family Partnership. My other question also was about some of the changes that you made. Julie, you mentioned that you made a decision to move additional money, and I kind of partly got the explanation is because you were saying that there was more money coming for home visitation. But how was the decision made about which program you were going to move the money to?
I just made that decision, an executive decision, based on the outcomes that I saw from our highest priority. And it just didn't sit right with me personally to cut a program 25%. And we were talking about $280,000 that would keep it whole. And I looked at all of the other areas and wanted to make the least amount of change to honor what the work group had done, and all of the work that had gone on throughout the whole process. And with the CalWORKs funding coming in, it just seemed like the least impactful place to take it would be from effective parenting in order to keep that result area whole.
Okay, and my last comment, of course, again, thank you for all the work, and thanks for the team also. I know it's very difficult to make these decisions, but I am disappointed that breastfeeding is going to be cut that much, because knowing just how much it impacts the early development, and it benefits the baby in so many ways, benefits the family in so many ways. And I know there's been comments about, well, it should be funded through the health plans, but the reality is it is not. And the families that do end up going to WIC usually don't have any other way of actually getting that support. So by cutting that, you're not, there's nothing that's going to fill behind it. So I would like us to really think about how, the cuts that we're making to breastfeeding.
Commissioner Sneeringer.
So I just wanted to weigh in both on breastfeeding and the home visiting conversation. I think that the hardest part about having to make funding reductions is things that we in the past have paid for ourselves. We now have to figure out ways to leverage and find ways to work collectively with the First Five Association, with First Five California, with our community-based partners to advocate for other sources of funding to come in and fill some of these gaps. And as chair of the Sustainability Committee, I'm very committed to looking both at all the different collaborative work that's happening around home visiting and around breastfeeding. There are many discussions going on, the First Five California funding to do local coordination around home visiting. I think that there is a tremendous interest in expanding home visiting in the governor's administration. And I think our job is to work collaboratively with our partners and with our contractors to seek out and find those dollars to fill these gaps. And, it's difficult. I think Supervisor Cerna started the conversation saying none of us want to do any of this, but as someone who's advocated in the childcare space, which is also slated to take a 40% hit, the justification for that is the interest and the potential new funding at the state and federal level, which is the same as it is for breastfeeding and the same as it is for home visiting. And I think that to be consistent across our priorities, if we are weighing those external leveraging options as part of our decision-making process, I'm very supportive of the approach the staff is recommending.
Great, thank you. Commissioner Moak.
Thanks. Once again, I'll first start by thanking those of the people that are still here that spoke up on behalf of your programs and the lives that you're touching. Those are the things that's why these decisions at the end of the day, although hard, are worth it, is because so many of you are committing your lives every day to helping people and advancing their own lives and their own stories. So thank you for doing that. We've been long staring at these cuts for, having been sitting here literally in this seat, I think, since 2005, having gone through one round of strategic planning where I was involved, and now having the chance to sit beside my colleague, Dr. Wirtz, through this process. It's making cuts is never easy. They always say the art of strategic planning is deciding what not to choose, and not choosing things is where people's lives are impacted is really hard. I heard some of you celebrate the fact that the cut was reduced, or maybe there was as much or more funding for you or your priority area than you originally thought. And I would just caution you that there are people in this room that are going to have to figure out how to do something with nothing. And so just be careful with your celebration as we move forward. If anything, it's a time to connect up, maybe like you never have before. So that's particularly looking at the breastfeeding group. They're going to need help, just like the families you serve every day. They need help too. So don't walk away from them. I'm going to say it just because I would regret it if I didn't. It was a little bit of a disheartening process this time around, having sat through the hours with my committee members, hearing input by all these parents, hardworking providers, going through and ranking these programs as if you can rank programs. scoring them, having discussion about their merits and their outcomes that they're producing, making some grueling, difficult decisions on what to leave behind, what to zero out, what to cut by 20 or 30 or 40%. We finalized our recommendations with heavy hearts, and then to hear it come back and that it was changed. That's tough. It's tough to go through a process like that. I can imagine if I was sitting through because we sat through those meetings, so did many of the people in this room, sat through every single hour of those meetings, and that's hard. That doesn't give you good faith in a process. And I don't want to go through something like that again. I won't go through something like that again. So I know there's still a lot to do. There's still time. I apologize for being a little bit emotional. My grandfather passed away today. I know, sucks. But he would have wanted me to be here. So thank you for all of you that came forward and for dedicating your time and your lives to this. I appreciate it.
Commissioner Gordon.
Thank you, Chair. I just wanted to echo my thanks to the committee for a great job, to the staff for a great job, and just to let people know that not only is this not easy, this has been a long time coming. We've known that this is coming, and I guess the request I would make going forward is various of these programs that are working to sustain the programs, most notably the breastfeeding. I'd like to see if we can get, before a year from now, some updates on how are they doing on achieving sustainability, because it may be that our voices, separate from our funding, our voices with the Board of Supervisors or others, could be helpful in moving towards solutions to leverage other dollars, because I realize that these funding systems, I've learned an awful lot in the last number of years about how Byzantine these funding systems are and how difficult they are to navigate. So for me, something like breastfeeding seems like preventive medical services. It would seem like there should be no question that should be covered somehow by someone. So I just ask on that and some of the other home visits, whatever it is, that we get some updates periodically during the year on how the sustainability efforts are going, so that we might be able to weigh in and help along the way.
That's a good suggestion. Thank you. Commissioner Turner-Johnson.
Just very briefly, clearly, all these decisions they're programs that have been funded because this county and this group and the Board of Supervisors believes in them, if not having even created some. I just want to make a comment. I recently attended as a representative the Breastfeeding Summit and was thrilled with all of the knowledge that I gained. I just want to say that there's a little bit of it that seems counterintuitive, only because we are trying to save children's lives in this county, all kinds of babies' lives. And so I'm delighted to hear that 85% of the Black Child Legacy children are pretty much covered, either through CalWORKS or Medi-Cal, but the other 15, and all the other babies. And the only other thing with home visiting is that the care in hospital is not typically, I believe, carried into the home for enough follow-up that we would not only help with lactation, that could literally, as we heard today, save a child's life, but also I think that without that, we miss opportunities of seeing other things in homes that are part of our data that we fund around SIDS and many other aspects, or violence, or whatever kinds of things we're collecting around that can literally provide the opportunity for intervention. So that said, I have to agree with all of my fellow commissioners that worked on this particular committee and so hard dealing with this, that the funding is coming to a shorter and shorter balance every single year. And I too was on the advisory from 05 or 04, and I remember talking about this day then. And yet I can't help but feel that this particular piece of breastfeeding and the issues of home visiting, as a longtime early childhood person, are so terribly important. And somehow, some way, if we can not just make a vote and then shelve this and find a way to help, that would be my recommendation, and I will be a part of it in any way I can. So thank you.
Thank you. All right, final comments?
If I could, I'm sorry to take time, but I feel the need to sort of acknowledge Scott's work on the committee and his concerns as well. And I think we all understand the process, and we want to have a process that's open, transparent, and well thought out. And so I want to acknowledge your concerns, Scott. And I think just to sort of state where the committee had come is that we did have a cut to R1 that was less than any other domain, even at the beginning. So we did recognize that. And I think we are going to hear on our next portion of this, in part, why we value the program that we're talking about in terms of the partnership with the Black Child Legacy. We have not seen the kind of results that have been shown through these programs and partnerships in many other programs, and so it does stand out as an incredibly effective community joint effort that First Five has been central in the beginning and has continued to play a significant role throughout. So I just want to acknowledge that the original cuts were less than other areas, but we are stuck with this situation of recognizing that we're cutting good programs one place or another. So just as context, thank you.
All right, thank you. So I have a question for Julie. It's a budgeting question. So we operate on a 3-year strategic plan.
Correct.
Is it possible to call it what you will, bridge funding? Is it possible to look at a single year of funding for something that I think I'm hearing from my fellow commissioners is important to them, for a 12-month period, not a 36-month period, that gives an entity the ability to work, whether it's through the Board of Supervisors or our local health systems, others in the community that could help develop the funding that might otherwise just evaporate from this commission. Could we do it on a single year basis with that very concerted effort in mind, and not just be, limited to looking at it in a 3-year time frame?
As in tacking on an additional year to the current strategic plan?
Here's where I'm going with it.
Okay, sorry.
So you said you did some math earlier on breastfeeding in WIC, and that it's about an $80,000 a year cost, right?
Yep.
So you didn't say, by the way, where you'd pull it from. And that's really what this exercise is all about. It has to come from somewhere.
Yes.
But conceivably, let's say it's $80,000 for a year to keep them whole. Could you conceivably split it down the middle, so $40,000 and $40,000 each from R6 and R7 for a year? So it's a very, very minimal impact to those result areas, which gives them the opportunity to not feel like today is the day. We can all kind of commit ourselves to helping find some resources so that the landing's a little smoother for them. Is that possible?
We can do whatever this commission would like as far as moving the money around. I just wanted to make sure that you understood that the $80,000 would move them from a 40% cut to a 30%
Understood.
cut, but not keep them whole.
I understand. No, okay. I appreciate you pointing that out, because we did hear from one of those individuals that testified on behalf of WIC that sounded like to me like the 30% versus 40% cut was a little more digestible.
Yeah.
So with that as the seconder to the original motion, I would like to make that amendment. And that way I think the bluntness of this is diminished. And I also think by doing it that way, we really minimize the fiscal consequence to the 2 result areas that it's going to have to come from. Does the maker of the motion agree with that?
Yes, so make amended motion.
Okay, I will re-second it. Okay, we've had ample discussion on this. Are commissioners clear on the amendment? Seeing head shaking? Okay, let's have a roll call vote, please.
Chair Cerna,
Aye.
Christina Elliott,
Aye.
Eric Hernandez y Garcia,
Aye.
David Gordon,
Aye.
Dr. Casserier,
Aye.
Bruce Wagstaff,
Aye.
Steve Wertz.
Aye.
And the motion carries. Great, thank you. Again, thanks to everyone for your patience and your willingness to be here in the middle of the afternoon to give testimony to this commission on, again, one of the most important things that we're asked to do. And I wish we were talking about a budget that grows, but that's not the case. So thank you again. All right, next item, please.
Presentations, evaluation findings from efforts to reduce African American child death.
Okay, great. Thank you for all of that. Still spinning a little bit. We're going to shift gears then, and Linda Fong-Samara is going to take the lead on this, as she's our staff person who's responsible for all of our efforts to reduce African American child death.
Good afternoon, Commissioners. Thank you for the opportunity to provide you with an annual update on our efforts to reduce African American child deaths. Today we're going to focus on fiscal year 18-19 in our update and show you some progress and some outcomes that we've been able to see in the last fiscal year. Since we've heard a lot in the past about the activities that our various programs focus on, we're not going to spend a lot of time focusing on giving you that recap all over again. We're really going to focus a little bit more on some of the data and really provide you with some information and stories to provide context to that data. We're going to start then with a really big picture of what's happening county-wide, hearing from our partners at Black Child Legacy Campaign, and then we will also hear from our partners at RSC about a new county-wide campaign that's coming out. Then we'll move on to hearing some data, and then finally we'll wrap up with hearing from some of our funded partners about the work that they're doing in our community. We have quite a few speakers today, so hopefully we'll be able to get through all the information, and I'm hoping we might be able to hold questions until the end of the presentation if possible, unless you really have a burning question. And so with that, I'd like to invite Natalie Woods-Andrews and Chet Hewitt. They are the co-chairs of the steering committee to reduce African American child deaths and also Black Child Legacy Campaign. Metro Cable, if we could also have the video pulled up, please, in the presentations.
is in need of a lot of support and resources and really be able to supply them with opportunities that may not have happened actually if it hadn't been for Black Child Legacy.
For us to go out there and to pretend that we know what's going on, we're doing ourselves a disservice. For this to truly be a community-led initiative and campaign, you need your residents at the table to lead and to let us know what they need and where the problems are.
I think whenever you're doing a movement type of work, you really have to ensure that you get the right partners, the right collaborations, and I can honestly say that we have that here.
I know it's been, things like this have been tried before, but never as comprehensive as this.
We didn't have before as a probation department where we can stay in one community, and the Black Child Legacy Campaign has definitely allowed that to happen.
So the model that the Black Child Legacy has given us to say, the Urban League, come and help us collaborate with the other partners, with the culture brokers, with people in the community, with smaller organizations.
People feel safe enough to open up with us. I love the fact that I'm able to offer more than I could offer if I was at a facility.
It's so far beyond the mission of BCLC, because when you start to build relationships within a community, you start to build community.
We're all gathered as one under one umbrella.
A lot of times that's unusual when you bring people from different backgrounds, different departments and programs, so we're real proud of that. Just looking at the willingness, I think Black Child Legacy Campaign is really making a significant change.
This really is a support mechanism that we're using. This isn't just a program. This is a safe, trusted environment where we will support you and not shame you, where we will uplift you and not put you down, and we will connect you and not block opportunities. We want to see you succeed because we care about the families that are here in our community. I know a lot of people in our community may not know what the Black Child Legacy is, but they will. And I hope that it will shed light for the lives that we have ahead of us and for this next generation.
Thank you. Can we have the PowerPoint, please? While they're pulling that up, we thought it would be a great visual just to show you how this really is a community-wide, county-wide effort that your commission has been a part of since 2013. And it's really through this collective impact model that we're starting to see results. So again, I wanted to introduce Natalie Woods-Andrews to come and speak to some of that work and some of the impacts that we're starting to see.
Thank you.
Thank you, Linda. Chair Cerna and members of the commission, again, it's a great honor to stand before you to share an update about the Black Child Legacy Campaign. I stand here as the co-chair, and my colleague, Chet Hewitt, he had to step away. But you know, I'm one person who's on the steering committee, but there is a great network that is standing and seated behind me that is a big part of the work that is moving forward. So I'd like to acknowledge that group today by having them stand. You're part of Black Child Legacy Campaign, community incubator leads, multidisciplinary teams. You know, 5 years ago, when we stepped before you to provide a presentation, we were just beginning this work. These were individuals who have been working kind of isolated in their communities because there was no system, no structure, no support that was being brought into the community. They were working in isolation, feeling alone in what was going on in the communities, yet they didn't know that they're all facing the same crisis. And so this has been an opportunity to really report on kind of the change in that underlying tone that has changed within the communities. So no longer are our communities isolated, working alone, but they are part of a network infrastructure today that I tell you, many individuals in this room, I as well, are native sons and daughters of Sacramento County, so this work became very personal to us. And we are better off because of the seed money that you have been able to invest in the Black Child Legacy Campaign. So we stand today united in our work. We stand as collaborative partners in this work very strong. And we stand here as individuals and agencies that are transforming Sacramento County. The investment of First 5 Sacramento really helped us with initiating the steering committee, and it was because of your conversations and your insight to really make that difference here in our community. This steering committee really did kind of lean in on the opportunity that was before us because of the data that continued to persist over 2 decades. We established the Black Child Legacy Campaign, and that was really our opportunity to just ring the alarm that there was a crisis here in Sacramento County. Our young children were dying at disproportionate rates, and we know that that also was for preventable reasons. This provided us with an opportunity to really help to address some of the inequities that we know our Black families were facing in our community. So I like to say that, you know, it was because of your investment, and it was because of the leadership and the guidance of my colleague Chet Hewitt, and his team at the Sierra Health Foundation, just providing that over leadership and guidance to this work that has truly helped us make that difference. So we're very thankful to Sierra Health Foundation as the backbone agency in this work as well. This opportunity really has created that change. We had a specific strategic plan, we had an implementation plan, and I feel that we have really stayed true to our mission and utilized your funds well. One of the things that we have learned over this 5-year process, as I shared with the advisory committee, we now know what makes a difference. We have discovered, as I said, that secret sauce of what really can make that difference to transform a community. And a lot of it is because it is community driven. There's no way that we could have done this work without that type of focus. We started off on a mission of our chief goal of reducing the death rates of African American children by 10 to 20% by 2020, and it's hard to believe that we are now in that year. And this is the year to stand for accountability. We continue to stay proactive and preventive, and we have continued to tell the story. We have been able to share the story in multiple venues, in 31 stories that have been produced about the Black Child Legacy Campaign in over 15 media events. They have been on TV, we've been in print, in newsletters, in the newspaper, making a spotlight on our efforts as a community. We have made significant impact throughout Sacramento County. And how we're doing it, it's because we're breaking down some of those silos and we're working across organizational lines. We are making sure that we're engaging the community. This is community-driven work that will make the difference. We're removing some of those roadblocks. Some of those systems that have been in place for many years are now loosening up so that we can truly respond to the needs of the families without some of the barriers that continue to persist. One of the big pieces that you've heard earlier today is we're strengthening parents. You know, parents are at the core of this work. If we're not focusing on the young children and the parents and the families, then we're truly not going to make an impact. But that has been first and foremost. We're developing our youth. You've heard in the past voices from our youth and how this work has impacted their lives. And I know you've heard about the news of data that is going to be shared with you today about how our youth are greatly impacted in positive ways because of the work of Black Child Legacy Campaign. We're healing families, keeping families together and whole, and most importantly, on our mission, we're on point of saving the lives of Black children. Our work has been successful over these past 5 years. We have an opportunity to continue to focus in on the preventable causes of death. We are going to be hosting the 2020 Violence Prevention Summit this year. We had an opportunity to share this story recently at the First Five California Convening on Health and Education with Chair Cerna and Julie Galelo and members who will also be speaking today. We've also had an opportunity to provide some input in displaying a digital health for our maternal focus on perinatal conditions, and then also utilizing a storytelling project, which we know is so important to share not only the data, but to really tell the stories behind the data. We've also been able to make an impact with policy and making sure that we're continuing to look for ways to secure and sustain funding, and then also to bring this work to scale. We have been able to continue to work with the Child Abuse Prevention Council as one of the members of the Prevention Cabinet to continue to seek out funding that will make a difference in Sacramento County, and also to make sure that we're aligning our efforts. And then lastly, we've been able to make a difference in the infrastructure that we have. It's something that didn't really exist prior to 5 years ago, but it was through our efforts that we were able to really network the communities together so that they are truly working across our communities in Sacramento County to support families. Families don't always stay in one neighborhood. Sometimes they do cross over into other neighborhoods. But there's a warm handoff and there's a system of support that will make sure that family does not fall between the cracks. And so one of the other things that I think has been highly successful is that we did not do this work with just a strategic plan and an implementation plan, but we did outline some indicators of quality to make sure that we were following our indicators and that we were measuring our progress in order to meet our goals. We've also been able to work with other neighboring communities as they have had great interest in the work that we're doing here in Sacramento County. It has not gone unnoticed. And so we now have partners who are very interested in replicating the work that we're doing in Sacramento County, who are housed in Central Valley and also in Southern California. So Fresno and Los Angeles are now initiating their efforts to really become more like a Black Child Legacy campaign in their particular communities. We are working with them to provide that leadership and guidance, helping them host stakeholder groups similar to our steering committee so that they can kickstart their campaigns in their communities. You know, this work is not unique to Sacramento County. There are so many communities that are facing the same crisis, and we have an opportunity to be those pioneers and really lead this work. You've already had an opportunity to see the video before you, but anytime we can shine the light on babies' faces to keep us at the core of this work. That is the center, that is the joy, that is why we do this work. It really is to save the lives of our children. While our approach has been very targeted for a specific purpose in communities, this work is universal. We're seeing many impacts that are filtering throughout our communities. Our work does not just end with Black families. There may be other families that walk into the community incubator lead, and no one is turned away. We're making sure that we really are supporting all families and meeting them at their point of need. And then finally, as I mentioned, there is an impact of a statewide expansion. We're really taking a look at how can we use the digital media project and storytelling about the lives of Black mothers and their experiences with giving birth and the challenges that they may be facing. Also making sure that we build that awareness that there are some great concerns that we do need to tackle throughout our nation, but we're on the cusp of really diving into this work about the work that has been greatly documented, Birthing While Black. We know that our mothers are facing crisis just because of the nature of their lives or in their communities. And so we really want to wrap our arms around our mothers to provide that support. And then also making sure that we're continuing to listen to our community and build this campaign forward so that we can continue to be that dynamic, community-driven approach that we've always had. As a steering committee member, we want to just thank you again for the work that you have been able to entrust in us. We took it very seriously. We told our community that failure was not an option for us. This is our community, and we want to make sure that we're doing the best for our children and families because they deserve our best. We've been able to utilize your funds to leverage additional funds from the agencies that you see here to really help us build out and expand the work that we've been doing with the community incubator leads, with our community leadership roundtable, also with our community intervention workers. We've also been able to leverage these funds to make sure that we're healing our neighborhoods. So thank you again for your investment. Thank you for having those courageous conversations and making those bold decisions to not wait another year because we can't afford to lose any more children. So thank you so much. You have made such a difference and an impact in our community. And I know our community incubator leads are going to share in great depth more of the impact that your investment has made. So thank you very much.
Thank you.
Thank you, Natalie, for your presentation. Next, we have another community-wide effort that you are going to be seeing, hopefully actually already out in the community. And so I'd like to invite our partners at Runyon Saltzman, we also call them RSE, to let you know about a community-wide perinatal education campaign that we're working on. And one thing that's unique about this year, we were gearing up to update our campaign, And one thing that's unique is that an opportunity for a new partnership presented itself. And I know there's been a lot of discussion about that happening today, and what you'll see is it's been a great partnership. In June of 2018, the governor signed in the California Perinatal Equity Initiative program within the California Department of Public Health. And what that did was really provide an opportunity for communities to look at ways they could look at possible interventions to fill in gaps around the Black infant health program. So our public health department got additional funding to do a series of activities to see how they could use some funding to fill in some of those gaps. There are activities such as hospital chart reviews, community forums, and of course a public awareness campaign. So we made the decision, we were approached to say, instead of having two similar or possible competing campaigns in the community, why don't we work together? So RSC is here today to share with you the result of about a year-long effort of really working together, our two departments. We have Lisa Hooks and Danielle Abe here from Public Health. Just really working together and really being in the community to listen and see what might be a great message to put out in our community. So with that, I'd like to invite Brittany Puccinelli, from RSC. Sorry, I didn't know which way to turn here. Thanks very much.
Hi everyone, my name is Brittany Puccinelli. I'm just one of many people that had the opportunity to work on this project. It was really a collaborative process between Sacramento County Public Health and First Five, and like Linda said, it's been a year in the making. It just launched yesterday, so I'm really excited to share with you how we got to where we are today. So, the first step in our process was to conduct formative research, and we did so with the support of Her Health First and Earth Mama Healing. And that research identified 4 key issue areas. And the first and most critical was the daily experiences of social and systemic racism and how that's impacting both Black infants and Black moms. So with that in mind, we did just more listening. That was RSC's role throughout the beginning and through the rest of the process, was to listen to families in our community and try to more accurately translate what we heard. So with the direction of First Five Sacramento and Sacramento County Public Health, we had a dramatic shift strategically. In previous years, we had focused directly in providing support resources directly to African American moms. But this year, we are pivoting to really focus on what we learned in the formative process. We are creating an awareness campaign for the greater Sacramento community to show how racial bias and discrimination is impacting Black moms and babies in our community. And this is true, this isn't unique to Sacramento County, it's happening across the country. It's being covered more widely by reputable journals and media outlets like the New York Times. So it's exciting for us to take this opportunity to be a leader in the country. So this is just a signifier of the many steps we took along the way to make sure we listened to our community partners and that their insights and their feedback was reflected in our work. Funding from the state allowed First Five Sacramento to convene a perinatal equity advisory board, and our partners at Sacramento County Public Health have graciously taken over that responsibility. So we've met with them all throughout the process and checking in to see if we got it right. And I think most recently when we met with them about a month ago, we heard from one woman after revealing the campaign that she felt like in the first time in 30 years she felt heard. So that just really felt special and like we were headed in the right direction. So the campaign you're about to see has been tested not only in the African American community, but as a community as a whole to reflect our diverse target audience, ages 18 to 54. We heard very common comments across the board, and we knew we had 3 critical imperatives when creating this campaign. We needed to show the real families in the community. We needed to ensure blame wasn't placed on those families. And that 3, we had a solution-oriented call to action. So I'm excited to share it with you in just a second. And it's truly the community's campaign. We've used real families in the community as the faces and voices of the campaign. We use simple facts and quotes and just bringing to life the reality of being a Black woman, an infant in our community and in this country. So without further ado, the campaign is called Unequal Birth. And again, this is just a testament of the reality for Black moms and babies in our community. Now I'm going to walk you through some of the creative. Again, it just launched yesterday through billboards and digital, and will be expanding over the next couple of weeks. So here are the outdoor billboards, and these are in 7 high traffic areas on the freeway. So we have the front and back side. And the first speaks to infant mortality. A baby's survival shouldn't depend on the color of their skin. And then the second, Black women are 4 times more likely to die during pregnancy. Billboards are great for building awareness, but there's limitations with how much room we have to tell our story. So we layered in geofencing, and what that means is that we have a digital barrier around our billboards. So if you drive by it, you're then going to be served up digital and paid social ads. So next is social media, and this is our opportunity to start further unpacking what our story is here. So on the left with our maternal mortality execution, you can see that we've done some myth busting at the bottom. These deaths are not due to education, income, zip code, unhealthy habits. They're better explained by racial bias and discrimination, and we ask the community to talk about solutions at unequalbirth.com. And the next is a infant mortality execution where we ask or talk about systemic racism and how that creates chronic stress for moms, which affects their unborn children. And again, driving them back to our website to learn more about this health crisis. The next ad here is intended for Facebook. It's a Facebook carousel ad. And this brings to life what we heard very frequently in the community. I feel like my voice isn't heard. I feel pressured to make decisions I know aren't right, and I feel lucky to be alive for my child. This is a storyboard. It's actually now a video with real voiceover, but this is, again, just another way to tell our story in the digital realm. We have very short attention spans, so it's 15 seconds long, and again, invites people to go to our website to learn more and talk about solutions. Just gonna skip through. So the paid media program, we've got 8 weeks of radio, and the next month we'll be launching our radio. I didn't play it for you because we're making a few adjustments to it. And it will be on top rated stations. We've got top 40, we've got classic, so a nice variety of radio stations. We'll be on digital advertising, Facebook, Instagram, Pandora, and targeted web banners. And again, with our billboards, we'll have 20 weeks. And this is the media plan through the end of June, and we'll pick back up in July through a more expansive digital program. So if you feel up to driving by our LED billboards, these are where they are located all throughout the county. And again, these were identified as very high traffic areas in the county. Knowing we're speaking to a greater Sacramento County audience, we wanted to make sure we were in a variety of places. And then knowing we're looking to build awareness, but really we needed to create a destination for people to learn more and to take action immediately. And so this is our Unequal Birth site. You can visit it at unequalbirth.com. And the landing page, this is just a screenshot, talks about the stats as a whole. And then if you continue to about, we talk more again about some myth busting, what's behind this, who's behind this campaign. And then research. We have categorized research into read and learn, listen and learn, watch and learn, however you like to learn more. There's an opportunity for you, and there's no shortage of research and data and articles to share. And this is a living and breathing site, so we plan to keep it updated with the most recent pieces that we can add. And then finally, we have our Take Action page. And this is just a call to action that regardless of who you are, you can play a role in improving these disparities. And we have at the bottom of this page organized ideas by expectant families, by everyone, and for health providers. And again, we're treating this as a living, breathing entity, and we have an option where you can contact us and share ideas or comments, and we plan to keep this updated.
That concludes your presentation?
It does.
Can I ask a quick question?
Of course.
The If My Mom Only Knew campaign was the one that preceded this, is that right?
Yes. Oh, sorry, it's before my time, but yes.
The what?
The stress campaign.
Stress campaign.
Stress campaign.
There was 3 versions. The If My Mom Knew, and then stress, and then this.
And then this one. And if someone was coming on and active in those prior iterations of the campaign, are they still being served some of this, able to kind of not lose their place if that's a place that they were going?
Yes, so our website that's focused on expectant families, Sac Healthy Baby, lives on, and that's really where we're continuing to drive people for support and resources. And this site is more expansive, talking about the issue at hand and how everyone in the community has a role. So they're two different sites. So good question.
Okay. Thanks.
Thank you.
Thank you, Brittany. I'm getting my steps in today, getting up and down. We really are excited to see that campaign. We're grateful for everyone's partnership and hard work on this campaign, and hope that even more people in our community become aware of this issue and get involved. So now that you've heard of 2 very broad activities that are happening across Sacramento County, I want to take a moment to kind of pivot a little bit, and we're going to focus in now more on our direct service programs. What we thought we'd do, though, is actually start off with some data, because we do have some really interesting and hopefully exciting data to share with you. I think what that data will show you is that all of our complementary efforts that are happening here in Sacramento County, whether it's through partnerships with Black Child Legacy Campaign, First 5, many of the other agencies, and both nonprofit and government agencies, all of us working together, health systems, all of us working together, I think you'll see that we are having an impact. And you'll see that reflected in some of the data that our evaluators at Applied Survey Research, or ASR, are going to share with you next. So I'd like to invite Jordan Bove to the podium.
Thank you so much. Oh, we need our PowerPoint up.
They'll work it for you. Just give them just 1 minute.
Okay. Okay, great. So this presentation is all about applied survey research evaluation of 3 different programs that First 5 has funded. And so I just wanted to start off telling you some of the rationale, and I'm sure that you all are familiar with this, but I do think it's important to reiterate. So the fact that in 2011, the CDRT team for Sacramento County released a report revealing that African American children were dying 2 times more often than any other ethnic group. This was already discussed as something that is a crisis both in Sacramento County and in the United States as a whole. in order to address this issue in Sacramento County, in 2013, the Blue Ribbon Commission on Disproportionate African American Child Deaths released a report with recommendations. And so the first thing that they recommended was an overall goal. The overall goal was to reduce this African American child death rate by 10 to 20%. But also, they put forth goals that pertained to the top 4 causes of preventable African American child death as well. The first was to decrease deaths by infant perinatal conditions by 23%. The next was to decrease infant safe sleep deaths by 33%. Decrease child abuse and neglect homicides by 25%, and finally to decrease third-party homicides by 48%. Of these 4, first 5 has been active in the first 3 goals that all pertain to infants and very young children. Additionally, they identified 7 different neighborhoods that seemed to have the highest concentration of these child deaths, so these sort of high-risk neighborhoods, and therefore focused most of their intentions toward these neighborhoods. So these neighborhoods were Arden Arcade, Fruit Ridge, Stockton Boulevard, Meadowview, Valley High, North Sacramento, Del Paso Heights, North Highlands, and Oak Park. So first, I'm going to talk about the public education campaign. This was from RSE, who you just heard from, but again, this is for fiscal year 18-19, so this is not focusing on what you just heard, which is their current campaign, but actually what their actions were during the last fiscal year. So one of the first large things that Runyon Saltzman takes care of for the public education thread of First 5 Sacramento's part of reducing African American child deaths is putting on a baby shower called Pride and Joy Baby Shower. This year, 18-19, had 113 attendees. The baby shower provides information for pregnant or new moms, as well as many giveaways and resources as well. They also tied in more to sort of try to entice the entire family to come. So they had a partnership with the Sacramento Kings, and they had the Sacramento Kings mascot and some of the dance team there as well this year at the baby shower. Additionally, you heard about the Sac Healthy Baby website in the last presentation. In 18-19, there were 2,170 visits to that website by 1,874 users. The biggest focus for the public education campaign in 18-19 was this new campaign that they were just starting, which you just heard about. So basically, formation and strategic development for that campaign took place over this past fiscal year. So they formed focus groups with women from the 7 high-risk neighborhoods. They had listening sessions with 27 African American community members, and all of their voices were heard in order to put together this media campaign that just started, which I passed a billboard for it today on my way here, which was especially apropos as I was coming to this meeting. The second of the 3 funded programs that I'm going to be talking about today is Safe Sleep Baby. Safe Sleep Babies is put on by the Child Abuse Prevention Council, and their entire mission is to educate mothers, pregnant mothers or new mothers, on safe sleep techniques in order to decrease safe sleep deaths among African American and all children. So 883 caregivers were trained in this past fiscal year on safe sleep techniques. 31% of those were African American, and 44, almost half of them, resided in those high-risk neighborhoods. They did a pre to post test among all of their participants, asking about what their intentions were for when they had their child, to then a follow-up after their child was there, what they were actually doing. So you can see on the left, intake is before they took the Safe Sleep Baby workshop, and then follow-up is after they finished the workshop and after they had their child. So you can see really, really striking increases among 3 of these 4. So never sleeping baby with blankets, always sleeping baby alone, and always sleeping baby on back showed really striking increases. The only one that did display a decrease was always sleeping child in crib. However, I would like to point out the fact that this started really, really high. So 96% of participants said that they were planning on sleeping their child in a crib. And even at follow-up, still 90% were sleeping their child in a crib, which is actually the highest safety behavior among all of them. And if any of you are parents, you most likely can relate to the fact that you may intend to do something to sleep your child in the crib, but when you're actually in the thick of it, it can be really, really difficult to do so at 3 in the morning when they're crying or you just want them to get to go to sleep. So additionally, there were 292 community-based service providers and 1 medical provider trained. And as part of Safe Sleep Baby, they also have a Cribs for Kids program. So this provides cribs to those who do not have one after they go through the Safe Sleep Baby workshop. So in the past fiscal year, they actually provided 450 cribs to families who needed them to provide a safe place to sleep their child, and 36% of those were African American parents. Additionally, one of the biggest sort of exciting things is that all 4 main hospital systems in Sacramento are currently on board with implementing the Safe Sleep Baby education. So that includes UC Davis, Dignity Health, Sutter, and Kaiser. All of them are partners with Safe Sleep Baby and are implementing that education. Okay, the third and final program that has been supported by First 5 Sacramento to reduce African American child deaths is the Pregnancy Peer Support Program. I'm going to talk about 2 different programs that are in this domain, but I'm going to focus on Black Mothers United. You heard from them a lot during the strategic plan portion of this. This will give you some data to sort of back up the stories that you heard. They also supported WellSpace Health, which is a different pregnancy peer support program that was actually just wrapping up in this past fiscal year. So I will spend a little bit of time talking about that, but they had a much smaller amount of clients than they have in the past because they are wrapping up that service. So first, all of this data that you see will be about the Black Mothers United program through Her Health First. The BMU program served 216 pregnant African American women during this past fiscal year, and almost 50% of them were from those 7 high-risk neighborhoods that I showed you at the beginning. Of them, we see that 63% completed their minimum prenatal services. This is split out in this graph to show you when they joined the BMU program. So how far along in their pregnancy were they when they came on board with BMU? So first trimester cohort, in order to be considered that you finished or you completed the prenatal services, you had to have 21 visits with your pregnancy peer coach. 25% of moms who entered in the first trimester did complete that. Second trimester cohort, so you entered during your second trimester, the requirement was to have 10 or more visits with your pregnancy peer coach, and 75% of them had that. In the third trimester cohort, the requirement was 6 or more visits to be considered to have completed the program, and 64% of mothers who were third trimester entries completed those services. As you can see, there are different requirements of how many visits that you needed to have in order to be considered completed the program based upon when you entered the program. So people who entered in the first trimester had a lot longer to have more visits, and so they had a larger requirement. So now I'm going to take you through some data from this specific program, so changes in both risk and protective factors from intake to then follow-up after the program. So first, I want to talk about protective factors. So being involved with WIC or on CalWORKS were both considered to be protective factors, things that are helping your family. At intake for WIC, 85 mothers said that they were on WIC, and at follow-up, that was up to 98%. CalWORKS saw a similar increase from 43% at intake to 59% at follow-up, and both of those were statistically significant increases. Risk factors across the board largely decreased. So again, the blue is intake and the orange is follow-up. So you can see that 33% of mothers reported having unstable housing at intake, and only 16% reported having that at follow-up. Another one that I'd like to draw your attention to is mothers who were reported that they were unable to fulfill their food needs decreased from 15% to 2%. And then finally, mothers who reported having anxiety or depression decreased from 28% to 15% at follow-up. So we're seeing some really striking findings coming from this program. This is still talking about the Black Mothers United program, and this is birth outcomes. So if you look in the leftmost column, this is all infants that were born in the program. And then it's also split out twins and singletons, so that we know that twins tend to have poorer birth outcomes. So we wanted you to be able to see those separately as well as a whole. So if we're just looking at all infants, you can see that 76% of infants had a healthy birth. Healthy birth in our terms was that they were born at a healthy birth weight and a full gestational age. 20% were preterm and 17% had low birth weight. When looking at twins, as expected, the outcomes are a bit poorer. So 20% had a healthy birth with both birth weight and full term. 80% were preterm, 70% were low birth weight. And then among singletons, we see much more positive results, 82% healthy birth, 13% preterm, and 11% low birth weight. We also ran regressions to look at factors that could statistically predict birth outcomes. And the way that we categorized birth outcomes were in 3 different groups. So the first was that there were no adverse outcomes. So that means that they had a healthy birth weight and healthy gestational age. The second group was that they had one adverse outcome or the other. So it was either low birth weight or premature. And then the third group was that they had both adverse birth outcomes. So we're predicting being more likely to have an adverse birth outcome. And what we found was that anxiety or depression at intake was found to independently predict having an adverse birth outcome, as well as fewer check-ins with your pregnancy advocate. So those women who had less check-ins were more likely to have an adverse birth. And then 2 or more prior miscarriages also came out as a factor that was predictive. Now I'm going to talk about the WellSpace Health group that I sort of gave you a little preview about earlier. So like I said, they had just partial year programming because they were just finishing out those women who had joined their group in the fiscal year 17-18. They operate out of 2 South Sacramento medical clinics, and they served 60 pregnant African American clients who their requirement was a little bit different than BMU's. Their requirement to have completed the program was actually just a solid 18 visits. They provided pregnant women with education about risk factors and how to have a healthy baby. And we have data from 43 of them who delivered by the end of the year 2018. Of those, 88.4% had a healthy birth outcome, 9.3 were born preterm, 11.6 were low birth weight, and there were 0 stillbirths. Additionally, in January, WellSpace Health began providing ultrasounds. This was a new program that they started, and so from January to June, they provided 7 women with ultrasounds, and they expect to see that number increase. Those are the 3 programs that I'm going to be talking about, but I'd also like to talk about county-wide trends that these programs have at least played a part in, although most likely not the only part. The first thing that I would like to show you is the staggering decrease in African American infant death over time. So I'd like to first draw your attention to our time periods. So Sierra Health Foundation and First 5 Sacramento and ASR agreed to use 3-year rolling averages for judging these sort of trend data. This makes them more stable, and you're able to sort of see a smoother version rather than annual numbers, which can be quite unstable. So if you look at the 2012 to 2014, you can see that the blue line is African American infants, and you can see that they're much, much higher than both all other infants from all other races, and then also much higher than the countywide average. And then if you look at the 2015 to 2017 bracket, although they're still higher, we see a large decrease in both the rate of infant deaths for African Americans and the disparity. So this comes out to be a 23% reduction overall and a 42% reduction in disparities between African American infant deaths and all other races. Now, if we're going to talk about those 3 other components of infant death that that First 5 has a part in, first, I'd like to show you the rate of infant death due to perinatal causes. This is a little bit less exciting, but we did see an increase all the way up to 2014 to 2016. There was an increase in the amount of African American infant death due to perinatal causes. This has actually come down for the 2015 to 2017 range. We're hoping that this is the start of a trend, but we'll have to have more data in order to be sure of that. The rate of infant deaths due to sleep-related causes is very striking and very exciting. So you can see the very nice stark decline for African Americans who are still that blue on the top. So they went from a rate of 3.7 per thousand to 1.6 per thousand. This constitutes a 57% in reduction overall, and then also a 33% reduction in disparities. And then I have one more exciting one to show you. And this is the rate of child death due to child abuse and neglect homicides. So this is for children 0 to 5, so it's not just infants like the other ones were. And I would just like to point out the very, very steep decline for African American children, sort of almost exactly the same as the non-African American children for the 2015 to 2017 years. And these decreases constitute an 85% reduction overall and a 98% reduction in disparities. So very exciting. And I would just like to commend First 5 Sacramento as well as the programs who have played such a large part in making these giant changes. Thank you so much.
Okay, thanks, Jordan. Okay, I want to do a time check because I know we already lost one commissioner, and we're heading towards our 4th hour of commission meeting, and I have 8 people signed up to speak. So I don't know what the balance of the presentation looks like, but I just want to be respectful of everyone's time.
Thank you, Jordan, and to everyone at ASR for all of your work to really pull together and analyze that data. I know we're limited on time, so I'm going to keep us moving along. And again, we just wanted to share with you not just that program data, but the county-wide data to show the impact that we're all having collectively in our community. I want to, again, pivot a little bit and bring forward 3 of our funded programs to give you some important context to that data. There's information that they have that might not be fully reflected in that data in terms of their day-to-day work and some of the barriers and successes that they face on a daily basis. I'd like to start off by inviting Danielle Lawrence from the Mutual Assistance Network. And on the heels of the impressive data around child abuse and neglect, one of the reasons why we wanted to invite Danielle is because their agency, the Mutual Assistance Network, is in the very unique position of being both a community incubator lead under the Black Child Legacy Campaign and also one of our family resource centers that we fund at First Life Sacramento. So no further ado, Danielle.
Thank you. Thank you, Commissioner Serna, other commissioners. I just stand before you to talk about the merging of our programs of Birth and Beyond and Black Child Legacy. I'm going to read so I can be more timely. As you may recall, in 2013, First 5 Sacramento opted to fund a 9th Birth and Beyond site located in Arden Arcade as a direct result of the Blue Ribbon Commission's report on disproportionate African American child deaths. It was with this lens of equity-based targeted work that we just embarked upon Birth and Beyond work. Our Family Resource Center had this lens as we started in 2013. In 2015, we became a Black Child Legacy Incubator as well. And so I think that I'll just kind of read to you some of the things we did as a joint site. We utilized foundations of Birth and Beyond to build our works, such as crisis intervention, case management, effective parenting workshops, and home visitation. We layered that work and we flipped it for Black Child Legacy and made the same work but targeted. So we ensured that we had cultural brokers that were working for us that were focused on just targeted services around crisis intervention, home visitation, parenting classes that really spoke to African Americans and getting those children back into the homes as necessary, and then to prevent child abuse and neglect. Additionally, we ensured that the resources that we did have as a Birth and Beyond site, such as Safe Sleep Baby and our pack and plays, our cribs, those are reserved for African American women. We knew that in our neighborhood, we were targeted and singled out as having a high disproportionate rate, so we really wanted to make sure that those resources went where it needed to go. Additionally, we engaged our multidisciplinary resource team, so probation, Department of Human Assistance, and CPS. At our locations, we engage them not only in Black Child Legacy, but they also benefit Birth and Beyond. And so we were able to utilize those supports for all of our families that walked through the door, and it was very, very rewarding to be able to do so. So we almost became a one-stop shop. Also, we were able to integrate the Birth and Beyond staff and AmeriCorps members that we have as a foundation for your funding as a Birth and Beyond site, and we infused them. We made sure they had the charge of Black Child Legacy. They had the charge to decrease African American disproportionate death, and they took that charge into their home visitation and parenting classes and all the services that they were able to provide. In addition to our Black Child Legacy staff. So it's like the whole entire organization picked up this charge, and Birth and Beyond was a vehicle, along with Healing the Hood being a vehicle. Let's see. As a result of the efforts that you started in 2013 and the commitment that you gave to create this 9th site, we are able to have super strong partnerships in Arden Arcade. We're able to lead as a trusted community organization. We're able to be the safe location for our families in crisis and in need of support. And we're able to participate and lead the integration into systems and advocacy work to continue to push for long-term transformational change for residents and neighborhoods of Arden Arcade. So we thank Julie for holding firm to her equity lens in her dedication to this charge, and we thank you, Commission, for being the first to say that this issue is not only demands outrage, but most importantly demands resources. Thank you.
Great, thank you.
Thank you. Now that we've heard from Danya, I'd like to invite Stephanie Biegler and Diane Wright from the Child Abuse Prevention Council, and they work on our Safe Sleep Baby campaign.
Good afternoon, Chair Cerna and members of the Commission. I'm Stephanie Biegler, Chief Program Officer at the Child Abuse Prevention Center, and I am joined by my colleague,
Diane Wright, Safe Sleep Baby Health Educator.
Before we begin our presentation, we would like to thank the rest of the CAP Center Safe Sleep Baby team, if they could please stand. Stephanie C., Alex, Bree, Maya, and all led by Gia. I am daily deeply moved by their dedication and passion that fills their heart to truly save babies' lives. The Child Abuse Prevention Center is profusely proud to have contributed to the reduction in numbers and disproportionality in the infant sleep-related deaths of African American babies. Our Safe Sleep Baby Education campaign is anchored by messages and materials both designed by and approved by 160 pregnant moms, new moms, and their moms who back in 2014 participated in numerous focus groups. Our Safe Sleep Baby message is 6 easy steps that we think are pretty easy to follow, and they are framed by 4 important words: alone, back, crib, and at the insistence of our parents always, bolded, uppercase, exclamation point. True to parent input, there never have been and never will be any stock photos in our campaign. Our brochures, videos, all contain Sacramento County moms, home visitors, grandparents, and physicians who have experience with sleep-related deaths. The baby pictured in front of you in our poster is the sibling of an infant who tragically died while co-sleeping with her mother. And what a brave mother that was to share her story with us all, so that other mothers would not experience the tragedy and the trauma that she did at the loss of her little baby girl. You do that for me. Okay. Is it this one? Is it this one?
No. Okay.
All right. Sorry, I didn't mean to waste time with figuring out how to learn the.
It's not working.
It's no longer working. No. All right. That's okay.
There we go.
That's okay. We'll continue. We will continue in the. Yeah. Well, thank you. Oh, there it is. Perfect. Okay. The CAP Center is abundantly appreciative of the First Five Commission and the $180,000 we receive annually from First Five to implement Safe Sleep Baby. Our program model was launched by and continues to follow the spectrum of prevention approaches that is widely recognized by public health education. Just to highlight a couple of things that we have been successful with are organizational practices. And as Jordan said, 4 hospital systems, all 8 birthing hospitals, educate on Safe Sleep Baby. Prior to Safe Sleep Baby, that was not done. And to answer the concerns of nurses, if a parent indicates they do not have a safe place to sleep their infant, they are given a crib, and CAPSI, the SSB team, goes out within 48 hours and educates the mom on safe sleep practices. What we have found, kind of by accident, is the spectrum of prevention is a very cost-effective and efficient way to design and run a program. We are linked with the Birth and Beyond Family Resource Centers, with the CILs, with Public Health, Nurse Family Partnership, and the Black Infant Health Program, as well as Set a Head Start. We have found that if we train their staff, they in turn go ahead and educate the moms they serve on Safe Sleep Baby practices. Child Protective Services is our most critical partner. Since 2010, our Child Death Review Report has analyzed data and found that an infant referred to Child Protective Services is between 2.4 and 2.6 times more likely to die of a sleep-related death than an infant who is not referred. And that is at the 99% confidence level. And of course, Jordan showed you our successes in strengthening knowledge and skills of parents and then measuring that. Okay. The table that is before you differs a bit from what Jordan showed you because it is actually the numbers for each year, and it was the numbers behind the 3-year rolling averages. In 2012, there was no Safe Sleep Baby campaign, and we had 25 infants die of a sleep-related death. In 2013, we did have a campaign funded by Safe Kids California, and it was not culturally relevant. In 2014, we went out into the 6 communities where 2/3 of African American deaths were occurring and held countless focus groups that designed and approved the program. In 2015, we launched the program and we haven't looked back. We have had 3 deaths of African American infants in 15, 16, and 17, and we're able to reduce disproportionality from a high of 50% in 2013 to a low of 20% in 2017. Diane will share with you some highlights and a heartwarming success story.
Safe Sleep Baby has its strengths and barriers. Parent engagement and building rapport is the reason why this program is so special and successful. Because our parents share their experiences with others, which leads to our referrals. Safe Sleep Baby also is breaking generational and cultural misconceptions of safe sleep baby practices, though through education and data. When parents take our workshops and see the data, they know why this program is so important. They know why it is vital to the community. And they leave the program with a better grasp of the 6 steps and also being able to feel empowered because they know by using these 6 steps can potentially save their baby's life. Our only barrier is the contradicting information that we get from hospitals that they tell our parents. Safe Sleep Baby follow the guidelines of American Academy of Pediatrics, which suggests no swaddling. Yet various hospitals has various forms of swaddling they tell to our parents. Now, I want to share with you one of our success stories. This man is named Kamir, and he is a father of 8. And this is his daughter also. She's 4 months old, and she was in need of a crib. And he was a referral from CPS. So when I contacted him, he told me he was no longer in need of a crib because he purchased one from the local thrift store. And he said he didn't need the workshop. So I suggest to him that take the workshop still because it's very beneficial. So me and my colleague went to his house the following day. And when we got there, I inspected the crib that he bought. When I got there, it had a hole in the side. It also didn't have the bassinet portion for his 4-month-old daughter. So, and also there were blankets and stuffed animals in the crib. So I knew right then it was meant for me to be there. So we did the presentation, and the 2 steps that stood out to him the most was Sleep Baby on back and nothing in the sleep area. After I finished the presentation, he asked questions of why that was the case. But after he knew all the information about why to Sleep Baby on the back and why to have nothing in the sleep area, he said he would never do it again. So when I actually went back to take this photo, his daughter was actually in her crib and she was on her back and there was nothing in her sleep area. So it's stories like this that makes me love my job. And thank you for letting us to be able to continue to save lives. So thank you so much.
Thank you, team at Safe Sleep Baby. Last but not least, I'd like to invite Shannon Shaw from Her Health First to share with you some information about Black Mothers United and the one-on-one support they provide to pregnant women in the community.
Hello again, it's been a long day. Again, I'm Kenya Fagbimi. I'm the program director at Her Health First.
And Shannon Reed, Executive Director with Her Health First.
And I wanted to give us an opportunity to get to know some of the clients. You met two of them that I'm going to be speaking about today. And we wanted to just be able to share some of the challenges that the moms have, but also some of the ways that we are addressing some of the issues as well. So the first picture up there is kind of our model mom that she has kind of all the tools that she needs to be successful, not only in her pregnancy, but also in parenting. And I think what she took the most from our program was our Mommy Mingle. Those are our monthly groups that we come together and have different topics and guests to come and speak to our moms. And those moms are able to share out some of the things that, their experiences, and they learn from each other. And so the second mom, am I going the wrong way? Is Ayana, who was here today. She had some financial challenges, but when she first came to us, she was a teen who was pregnant. She had no prenatal care. She was raised in foster care system, and she had very low self-esteem. And she had some essential things in place. She had some money that she was getting through foster care and housing as well, but she didn't have a good relationship with her counselor at the time. And there was a lot of back and forth between her and the counselor, and Leona, who was her pregnancy coach, had to kind of step in. And what Ayana heard from her counselor was that she was not going to be a good mother. And not only did she tell Ayana that, she told her pregnancy coach. So the pregnancy coach quickly started to work with the counselor to repair some of the challenges that the counselor was bringing up, which were valid concerns. However, this is a teen still who thinks she knows it. She's not an adult yet. And now you've told her that she's not going to be a good parent, so all of her fears come rushing forward. My child's going to be in the foster care like I did. So we quickly started working with her on some of the things that we saw that were really positive going on in her life, and really just address those things that were concerns, and really got her to stay in her own home. She was living over at her mom's house, even though she had her own apartment, and I think there was just some fears about living on her own, how to take care of herself, how to cook, how to prepare the things that we normally prepare, that we adults do when we live in our lives. And so Leona really started to walk her through those things, taking her to a grocery store, shopping with her, showing her how to break up chicken and be able to save it, and the things that she needs to keep stocked in her house. That was really the work that really had to come into place. And this mom just kind of nonchalantly said that she wasn't going to be able to go to her prom. Leona quickly jumped in, found a couple of dresses for her to choose from. Another pregnancy coach reached out to someone that was able to do hair and makeup and provide that as a free service to her. I came on a Saturday, picked her up, took her to go and get the hair and makeup done, and it was a team effort, but she got to go to prom. And we know that that's an important milestone for teenagers to be able to go to prom. And so we made that a reality for her. And just all the things and the struggles that she was going through, one of the things that was, or a couple of things that were very apparent to us, is that education was important to her. Having relationships with her peers were really important, and her being able to be a good mother to her baby. So she was a part of the Teen Success Program, which was giving her important parenting skills, and she was also able to balance and learn how to balance what it is to be a mother while she's still a teen, still going to school. She was able to graduate from high school. She worked at the school campus as well, and she went on to pursue her higher education. She went into dental hygiene. And so those are just some of the success that we've seen out of her story that we wanted to highlight today. Then we had another mom that was here today, that was Tiffany, whose story is not always the story that we want to tell necessarily, because she had some real challenges. She was homeless, she had substance abuse, and she hadn't really informed Tony of that. She kept that as a secret. And she went through her pregnancy, and at some point, or either all the way, we don't know, still battling with substance abuse. And so Tony is the type of person, she goes all in when she has a client. That's Tony with an eye over there. She goes all in with her clients, and there's nothing that you can't bring to her that she's gonna shame you for or turn you away for. She had her baby. The baby was tox positive. All 4 of her children were removed from her by CPS, and Tony's heart was broken. And this was a very pivotal moment, and why I thought it was important to share this today is because Tony went into it. She had to do a postpartum visit with Tiffany, and they did the visit, handled the paperwork process, and Tony gets the paperwork and walks away. Tiffany goes her way. And they really didn't discuss what had just happened, that her 4 children had been removed. Tony was at a place where she felt like, I don't know what else I could do now for her. And this is quite often the time that mothers go even deeper into their addiction. And so Tiffany ran out, told Tony that she was sorry, and she gave her a hug, quite like this hug that you see on the screen here. And she felt her sincerity. She felt that there was more that she could do for her, and she chose, and I say chose because she could have walked away from her at that moment. She was done pretty much with program. And she chose to stay in her life and help encourage her to become sober and clean. And she was clean. She is clean and sober today. She has finished school. She'll be finishing school in May. She took a medical assistant course so that she can have employment once her children are returned to her. And she also completed all of the programs that CPS and all the services that they told her that she needed to complete. And so she's finished all those things. Her children she's scheduled to go back to court next month, and it is that she will be receiving her children back. This is a mom that truly had a lot of barriers, and it showed up just as it is. Addiction is what it looks like. That's the face of that. And she was able to get through that, but she needed the support to be able to do that. And I think Tony did an awesome job in working with her and encouraging her. That mom made no excuses. Yeah. But Tiffany made no excuses for the choices that she made. And Tony rose to the occasion to help her through it. And so they are forever locked. And she told us we can't get rid of her.
I don't want to be a spoiler here, but we're losing people. And
Yes.
so while we absolutely appreciate the presentation, I'm feeling really bad because we've already lost, I think, 3 or 4 folks that want to speak as members of the public. So I'm going to respectfully ask you to wrap up. And Linda, you don't have to come back to the podium. We're just going to go right to public testimony before we lose the commission here.
Thank you for your time.
Thank you.
Do you want me to finish, or do you want us to just be done?
Why don't you, some concluding remarks would be great.
Just and really short. I think I've gotten good at this in the last couple of weeks of just being done. Our last slide, it's not to reiterate the data, but I think that what has been really nice about this evaluation report is our ability to use this information to continue to improve our programming. So I think those key points about homelessness and mental health, also the number of visits that clients receive from their coaches as having major impact. So those are really the key areas that we're focusing on right now and making a lot of strides. So I look forward to next year being able to update you on how we've made impact on those 3 things. Thank you so much.
Thank you. Appreciate it. Okay, is LaToya Freeman still here? I'm here. You're up. And then Dr. O?
Good afternoon.
Good afternoon.
I'm here speaking on behalf of Black Child Legacy. I am the program coordinator for Fruitridge Stockton CIL, and I also do program outreach for Her Health First. I want to start by thanking all of you sincerely for all your support and for believing in Black Child Legacy. This has been a tremendous year for all the 7 CILs. From north to south and east to west, our impact on our community has been seen, heard, and felt. We have been actively supporting our wonderful communities and engaging with our families. Our Fruitridge Stockton CIL in particular has experienced tremendous growth. We have 9 partners now who help us with our families in our 4 focus areas. We have 4 successful community events this year: Trunk or Treat. We had a Jingle Mingle for the families, which was a Christmas event, and we also gave out turkeys during Christmas to support our families. We've had an awesome MDT team. I apologize, some of them are not here, they left. But we currently serve 29 high-risk families in the community. We have been very successful in providing reunification of families and avoidance of children entering into the CPS system. We have been successful with connecting our families who experience domestic violence, AOD, mental health, and homelessness with the gift of an open heart, a listening ear, and also providing them with reassurance and understanding. And much needed support and connection to community resources, because a lot of our families are not aware of the services that are available in the community. So a lot of the families do come to us with extreme issues and needing those connections. Lastly, thanks to our partners and our successful collaboration, our CIL has been able to provide our families with meals, diapers, and formula, because our CIL has opened a food closet to support our families. And we found that we serve at least 20 families a month for that. So
that's great.
I just want to thank you for your continued support.
Thank you.
Thank you.
Dr. O?
Hey, how y'all doing today? I'm Dr. Joe Montanucci with the Black Child Legacy Campaign, the program director of the Del Paso Heights North Sac Community Incubator. I just wanted to thank you for your continued support of Black Child Legacy Campaign. Looking forward to the work that we'll be doing with you all in the next upcoming years. Just to give you a little bit about Del Paso North Sac. One of the things that talked about for the last couple hours is the attention on saving Black children's lives. And we like to say in Del Paso, when you save Black children, you save all children. The emphasis being that we are focusing on health, education. We're focused on mentorship and collaboration. So we in the Heights have done a very good job, I believe, of collaborating with our other community partners, collaborating with everyone that you have heard up here today. I don't want to go name by name, but they have done a good job of explaining some of the work that we've been doing, but specifically focusing on education. How can we support families through the education process, getting them from pre-K all the way through postgraduate education, right? Graduate school is the goal, not just college for our babies. We need more doctors in the community. We need more masters. We need more social workers, right? And we know that these things require a postgraduate degree and not just a bachelor's degree in education. So one of the things that we're most proud of that we really wanted to share with you all before we left is that we are starting, our emphasis this year is really looking at infant health and prenatal care. And so we have started a Sister Friend program, which is really similar to the peer support program that Black Mothers United has. We've also contracted with a doula who is starting some prenatal health care, community-owned prenatal health for our families. And then last but not least, we have helped 4 families get their children from or out of the expulsion system within Twin Rivers and North Natomas Unified School District. So we are putting where our money where our mouth is, and I'm gone. Peace.
All right, Crystal Harden? Is Crystal here? Crystal Hardy? She left, okay. Nisha Williams? Okay. Joe Johnson? He left too, all right. Yolanda Stevenson? Gotcha.
Thank you, Council, for your continued support of BCLC.
Thanks for your patience.
No problem. We're here in solidarity as usual.
Yes, our team left.
I am the program manager for the Meadowview Black Child Legacy Campaign, and want to just give you just a brief of what we do here at Meadowview and how your collaboration have impacted our work and the work in the community. At the BCLC Meadowview Community Incubator, we have and continue to impact and bring back support and advocacy to our African American families. We look to our case management through the lenses of trauma-informed care and positive relationship building. We have served in the past 4 years over 250 Meadowview families. We have successfully assisted our families on the road to self-sufficiency through housing, employment, life skills, child care, after-school programs, and mental health services as well, as connecting them to our families, to various community partners and resources to achieve their case plan goals. Our effective collaboration with the Department of Human Assistance, Department of Child, Family, and Adult Services, and our wonderful CPS Cultural Broker Program, which is Ms. Margot Santana right here. And that program is specifically designed to assist African American families navigate and understand the CPS system as their advocates to reunify or prevent the separation of their children. Probation, Sacramento Employment Training Agency, and now we have a partnership with UC Davis Psychiatry and Trauma Recovery Center, who comes to our center to provide free mental health services once a week to our families. And in addition to that, we now just formed a new partnership with Affinity Counseling Group that will be offering free and sliding scale rates of culturally relevant and competent mental health services to our Meadowview families. That is much needed on so big of a level right now. So these partnerships has intensified our effectiveness to bring a level of quality services to a population who have been neglected and forgotten. With the Black Child Legacy Campaign and the Rose Family Creative Empowerment Center, we are now a stable place to infuse families with empowerment, dignity, and self-respect, and resources and tools to live the lives that they deserve. Thank you so much.
Thank you. Latanya Mosley.
I'm here, everybody's leaving. Good afternoon, everyone. My name is Tanya, and I'm here representing Mutual Assistance Network, the Art and Arcade Community Incubator Lead. Art and Arcade is a unique community. In Art and Arcade, we see the highest income inequality, with the top earning 58.2% of the income and the bottom only earning 2.1% of that income. The implications are that Art and Arcade doesn't need resources, because there has been an intermingling of the haves and the have-nots that has overshadowed those that have not. Mutual Assistance Network has been honored to pick up the charge of this work, not only through BCLC, but also by intentionally fusing Birth and Beyond with BCLC to expand the work, charge, network, and support in a way that increases access and reduces disparities. Because of this, the community we serve in has BCLC, through BCLC, we have been able to serve and support the most vulnerable in our community in a targeted approach by providing resources that reduce the disparities around sleep-related deaths, perinatal conditions, child abuse and neglect, and third-party homicide to African American families. Because of BCLC, we have seen a collaborative effort that transcends neighborhoods and zip codes. Because of BCLC, we have seen a decline in the overall rates of disparity amongst African American children, and that is no small feat. I'd like to close with words from Barack Obama. We have to acknowledge the progress we made, but understand that we still have a long way to go, that things are better, but still not good enough. Here's to 2020 and beyond, to the continuation of saving Black children's lives. Thank you.
Thank you. All right, Ms. Jennings, you're up.
Thank you, Chair Cerna and members of the Commission. Thank you for your endurance today and always. I just want to thank you for your support for the Black Child Legacy. It works, and it works well. And the Greater Sacramento Urban League is glad to be a part of that, to be in Oak Park, because there are a couple of key things about this that you've heard, that it is the Black Child Legacy connects community and it brings together resources. It also serves as a relatable and impactful way that through cultural brokers, and then it also builds capacity that leads to sustainability. I want to turn it over to our program coordinator, Jadida, to sort of close you out and let you know just a glimpse of what we're doing in Oak Park.
Hi. In Oak Park, we're making a huge effort in meeting our families where they are and assuring them that they are engaged as a whole person. We realize that the resources that are available but are unaccessed by our families because of the barriers that brown and Black families face specifically. We're partnering with local health care providers, local schools, and other agencies, to name a few, to bridge and aid in providing a holistic approach. We've catered educational materials so that it is fitting and appropriate to our families, and we've invested greatly in building relationships, supporting and influential relationships. Our staff has been instrumental in urging our families not only to learn, but to engage and participate in necessary services available to them. Our parenting empowering classes is a specific way that we are making this information accessible to Oak Park. This happens in settings where our families are comfortable, like the schools that their children attend and the housing developments that they live in. We go the extra mile to make a way so that the information and the resources are accessible and in a package that they are open to receiving. Then we challenge them to engage and support them to apply it. I want to highlight that the language and the practices that we provide are relevant and are needed. We engage with our clients We engage with our families with language that is appropriate to their culture. This is a strength that is specific to the way Black Child Legacy does and services our families, and I think it is imperative as the work goes forward. Thank you.
Thank you.
Thank you.
Julie or Linda, do you want to put a bow on this, or you want me to do it?
You go ahead and do it.
Well, let me, again, just apologize because I felt like I needed to kind of move things along today. Primarily because I don't want my fellow commissioners peeling off and not hearing from everyone. And I know, we're all torn in terms of our schedules today, but I got to tell you, and I've said it lots of times, this is the most important work we're doing in this county. And, if you don't believe me, you can talk to people in Miami, Florida that know about it. You can talk to people in Washington, D.C. that know about it. People in Southern California that know about it. This has garnered national attention for good reason, and it has to do with all the substantive commentary today that we've heard, not just from Black Child Legacy Campaign partners, but from people that it serves. And so this should not be the best kept secret. We do not want that. We want this to be what it has become, and that is a model. And, I won't belabor the history of how this came to be, but this is really owned by the community as it needed to be. It's owned from the perspective of we're being honest with ourselves about a persistent problem that has plagued this county for decades, but we're also being honest about what we believe to be are the solutions that come from the collective impact model that we've deployed. And so I just, I really don't have more words to express how proud I am of it all, and extraordinarily proud that this commission has played an integral role in its success. In fact, this was the first agency, even before the county was all in, and before the city of Sacramento was all in, it was first 5 that stepped up and saw the merit of rising to the challenge of addressing the 4 leading causes of disproportionate African American childhood death in Sacramento County. And so I commend my colleagues for their commitment to it throughout the years now. I know that the last item was a very difficult decision, and it wouldn't have been fair, quite frankly, to put this item before that item, because I think it would have been a very lopsided afternoon in terms of really understanding some of the other initiatives that were responsible for providing resources so that they too can succeed. But when you're measuring success, and you're measuring it by the number of kids' lives you save, right? That's the ultimate metric in local government or any level of government. That's the ultimate metric of success. And it's this community, this county, this commission that really should pride itself for its role in that. And certainly everyone that was here today and those that couldn't be here today that I know remain very engaged in making sure that Black Child Legacy continues to expand and that we continue to save lives in Sacramento County. So I don't know if my fellow commissioners have anything to add. This was intended as a presentation, and we certainly got that today. Yes. But a great presentation. I mean, it really does my heart good to see it. I know it does everyone else's. So, all right. With that, our next item.
Commission member comments?
Okay. Comments from commissioners. It's been a long afternoon. We're awfully quiet. I'll just say that I again had an opportunity to join Julie and Linda, as well as some of the others that we heard from today, about a week and a half ago down in Irvine to speak in front of a First 5 California conference and spread the gospel of what we're doing here in Sacramento. And as was made mention in part of the presentation this afternoon, Fresno and LA counties are looking, or their First 5s are looking very seriously at kind of replicating the model we've used here. So that's a good sign. All right.
Sorry.
I'm putting you to a test.
That's my last item.
That's it. Okay. Julie, anything?
No, sir, we've said enough.
All right. All right, again, thanks to everyone who took time to be here and join us today. If there's no further business in front of this commission, we are adjourned.